Yeah, so yeah, it's okay. So yes, everyone can hear me. Is the screen clear? Just let me check. Okay, yeah, yes, Dr. Puneet. Yeah, so it's okay. So we can start the session. That means I was just checking everything is fine so that we can start the session. So today was your anatomy. So yes, Tejas, yes, hello everyone, and welcome to the session of anatomy MCQs discussion. Today there was a test in the institute, and you must have appeared for the test of 100 anatomy MCQs, which will be very relevant for you to revise all the important points. So what we are going, so clear voice, okay, great. So yes, that is great. So let's start with the session without much of the time getting wasted. It's important that you should utilize the most of this time. So let's start with the first MCQ. So the first MCQ of today's test was, let me read it for you. A 68-year-old woman presents in the emergency room with dizziness and nystagmus. Examination reveals a loss of pain and temperature sensation over the right side of the face and the left side of the body. The patient exhibits ataxia and intense tremor on the right in both of upper and lower extremities, and is unable to perform either the finger to nose or heel to scene task on the right side. In addition, she is having hoarseness and demonstrate pupillary constrictions and drooping of eyelids. Okay. Finally, the right side of her face is drier than the left side. So, which of the following artery block could explain the patient condition? So, I am getting answers Hoppy, Traveler, and yes, A is perfectly right answer. Absolutely correct. Actually, this is the case of, if I am going to enlarge this, and the key points which will help you to go to the correct answer, the key point is that the pain and temperature loss occurs over to the right side of the face. Okay, pain and temperature occur to the right side of the face. Yes, I can understand many of the students are telling A or B. The correct answer is A. The reason is that why A is the correct answer, I will tell you, because this is a case of Wallenberg syndrome. This is a case of Wallenberg syndrome, and which is also called as lateral medullary syndrome, and here we have got ipsilateral loss of, it's a syndrome, I guess. Yes, Dokat, absolutely right. It's a case of Wallenberg syndrome, and it's also called as Pica syndrome. And here the possibility which is seen and the sign and symptoms is pain and temperature is lost over to the right side and left side of the body. So this is the hint. Yes, Wallenberg syndrome. Absolutely right, dear Dokat. So that is giving us the right answer, that the loss of pain and temperature on ipsilateral side and contralateral side of the body. Also ataxia, intense tremor. This is due to involvement of the cerebellum, inferior cerebral peduncles, and due to the involvement of cerebellum there is the person is not able to perform finger nose test or heel or to scene task. So that is the reason, and definitely right side is the right answer. So right posterior inferior cerebral artery is the right answer. See here, what you will see in lateral Wallenberg syndrome, lateral medullary or Wallenberg syndrome, what you can see, there is injury to Pica artery. What is Pica artery? Posterior inferior cerebellar artery, which is giving blood supply to dorsolateral part of medulla. तो यहाँ पे क्या होता है, dorsolateral part of medulla का blood supply affected होता है, and because of that the nucleus which is involved in this area is the vestibular nucleus, spinothalamic tract. So here is vestibular nucleus that is required for the balancing, spinal tract and nucleus of trigeminal. So actually trigeminal is required for the innervation of the same side of the face, and nucleus ambiguous is involving the larynx, pharynx and soft palate. Spinothalamic tract is for the contralateral side of the body sensation. Okay, so that is absolutely the right answer. Okay, so we have got the right answer. Let's move on to the next. So absolutely this is a case of lateral medullary syndrome, which is also called as Wallenberg syndrome, which is also called as Pica syndrome. And there is an injury to which artery? Pica artery, which is affecting. So here the lateral aspect of dorsolateral, mainly the dorsolateral aspect of medulla is affected. Okay, now coming to the second question. So let me read it for you, my dear aspirants. A 44-year-old male policeman by the profession reported heel pain for approximately 1 year and tenderness at the calcaneal tuberosity. The pain was most noticeable in the morning but was reduced after 30 minutes walk. On examination, he had weak foot muscle, tibialis posterior flexor hallucis longus, and excessively weak calves and gluteal muscle. His imaging reveals a probable diagnosis will be by union Achilles tendonitis, plantar fasciitis or Morton. Plantar fasciitis is the right answer. Yes, absolutely. Plantar fasciitis is the right answer. Actually, some of you can get confused with Achilles tendonitis, but as the imaging has been shown to you, this is the image which has been shown to you, and definitely it is a case of plantar fasciitis. Yes, absolutely right, dear. Absolutely right. This is a case of plantar fasciitis, and the reason is that why this is a case of plantar fasciitis, I will tell you. Actually, what happens, we know that the foot, the sole of the foot, if I am talking about the sole of the foot, it is having a covering of plantar fascia, and if the plantar fascia is thickened, and what will happen if it is a thickened band, which is, we know that plantar fascia is lying on the sole of the foot, and it is a thickened band which is covering the bones and the bottom of the foot. If there is excessive friction, or there is a thickening of this band and there is excessive inflammation in this area, it can cause a case of plantar fasciitis. So definitely plantar fasciitis is the condition of inflammation of plantar fascia. Okay, if you want to define what is plantar fasciitis, it is inflammation of plantar fascia. So definitely if this diagram is given, and we know that plantar fascia is connecting the sole from the lower aspect of the calcaneum bone and going towards the anterior aspect towards the toe. So this whole is the inflammation of plantar fascia causing the case of plantar fasciitis. So definitely that is the reason we will go with C as the right answer, and many of the students, Dr. Aswadhama, Vipul, Vermil, Singh, World Cricket, everyone has absolutely, Hoping Traveler, all has given absolutely a correct answer. Now going to the other option. So the other option was, here we can see there is actually in the radiological image also the arrow was marked here, and definitely it is a case of plantar fasciitis. I think this image is after the class, ma'am, don't remove the video from YouTube. Sure dear. So this is the case of plantar fasciitis. Now when you will see, actually I also want to rule out the other options like B unions and all, Achilles tendonitis and all, other option which was provided. Now there is a way of solving the MCQ. When I am talking about certain ways of solving the MCQ, there is if you are knowing the answer, you can directly mark. If you are not knowing, you can rule out the options, incorrect option. Now why the biunion is not the right answer? Because whenever we are, this is a diagram which is showing you, this is an image of a patient showing biunion. A bony lump is seen on the outside of the big toe, and we can see that it is often seen in cases when the person is having a habit of straining their foot by wearing very tight shoes or heels for long duration of time, and this is a painful condition, and generally the affection is occurring. Which area is affected? It's laterally deviated, is the big toe. So definitely this can't be the right answer. If I talk about Achilles tendon, the inflammation is on the common insertion of the soleus muscle, gastrocnemius muscle and plantaris. We know that these are the calf muscle which directly insert onto the calcaneum bone, and together these tendon is forming Achilles tendon. So commonly if we talk about Achilles tendon, there is stiffness in the Achilles tendon with activity, severely pain in the morning. So actually the clinical history which is provided can be confusing if we want to go to this MCQ. So you can get the confusion here that maybe the right answer can be Achilles tendonitis. But why plantar fasciitis? Because radiological image is definitely giving us the right answer, that it is a case of plantar fasciitis. Motor neuroma, another option was the case of motor neuroma. Actually when I am talking about motor neuroma, it's a case of nerves being affected, and in this case the pain is severe, burning and numbness will be there. So such kind of clinical history was not provided in this MCQ. Definitely this is not the right answer. Now let's talk about question number 3rd. Which of the following muscle forms the floor of digastric triangle? Can anybody tell me what is the other name of digastric triangle? Can anybody tell me what is the other name of digastric triangle? Anyone who wants to reply, please let me know. What is the other name of digastric triangle? This is an MCQ about digastric triangle. So, can you tell me what is the other name of digastric triangle? Actually, digastric triangle is also called as submandibular triangle. Submandibular triangle. And if I talk about world cricket, the correct answer is mylohyoid. If I talk about hopping traveler, the correct answer, the structure forming the floor of digastric triangle will be mylohyoid muscle. Mylohyoid muscle. Actually, two muscles are basically forming the floor of digastric triangle, that is hyoglossus muscle and mylohyoid muscle. Digastric triangle is the other name of submandibular triangle. I would like to show you this diagram. Actually, this is one of the triangle of anterior triangle. So, I would like to highlight. Yes, hopping traveler, you are absolutely right. So, this is the anterior belly of digastric. Okay, this is the anterior belly of digastric, and this is the posterior belly of digastric, and close to it we have got the stylohyoid muscle. Okay, so here I am just enlarging this. Please see this diagram nicely. This is a diagram from Gray's Anatomy which will help you to understand. So, here we have got the mandible. This bone which you are seeing is the mandible. Yes, Aswadhama, you are also right. The correct answer is A. Let me just explain. If you will see this, this is the mandible. This is what? This is the mandible lower border. And if I want to define the triangle, so what you can definitely appreciate here, this triangular space which you are seeing here, this triangular space is the digastric triangle. Now, what will be the boundary of the digastric triangle? The boundaries are, it is bounded above by the mandible, and antero-inferiorly by the anterior belly of digastric, posterior-inferiorly by the posterior belly of digastric, and that of stylohyoid muscle. Okay, the apex is lying at the intermediate tendon attached to that of the hyoid bone. So, this is the boundary, and here if you will see nicely, here we have got two muscles which is forming the floor. One is the mylohyoid muscle, another is the hyoglossus muscle. So, digastric triangle, if you want to define, you can just write down. Digastric triangle, which is also called as submandibular triangle. Floor is formed by so here floor is formed by mylohyoid. Floor is formed by mylohyoid and hyoglossus muscle. Hyoglossus muscle. Floor is formed by mylohyoid and hyoglossus muscle. Okay, floor is formed by mylohyoid and hyoglossus muscle. Okay, now, so the correct answer here will be mylohyoid. Now, coming to the next, that is the question number 4th. A 5-year-old boy is brought to the emergency department by his parents due to persistent nasal bleeding. The boy picks his nose frequently and has had several nose bleeding in the past, all of which stops spontaneously after pinching the nose. The parents say that they have been pinching the nose area for over 40 minutes while the boy leans forward. Family history is negative for bleeding disorder and the patient takes no medicine and has no allergies. Examination shows continuous blood trick from his right nostril. Silver nitrate cautery is performed and the bleeding stopped. Cautery was most likely to be applied to which of the following location in this case of the nasal bleeding? So, yes, the correct answer is nasal septum. Yes, actually nasal, absolutely correct. Actually nasal septum is the right answer because we know that bleeding is definitely occurring. If we talk about the bleeding, it is definitely occurring from the nasal septum, actually antero-inferior aspect of the nasal septum. Actually in this case you can say the patient has, when the patient was pinching the nasal ala for 40 minutes, the boy, after that we have seen that silver cautery is performed and the bleeding stopped. So, actually these all, we know that antero-inferior aspect of nasal septum is an important site of bleeding. So, definitely in this case Kesselbach's plexus is involved, which is in the little area of the nose, and that is the reason of bleeding from the nasal septum. So, yes, this is a case of nasal septum bleeding. So, here Little's area of nose is involved, and Little's area of nose is involved, which is causing bleeding from the Kesselbach plexus. So here what I want you to show this diagram where you can appreciate here, this is the nasal septum, and in the nasal septum you can see, in the nasal septum there is Kesselbach, there is a Kesselbach plexus, and you can see in the nasal septum the Kesselbachs, there is also formation of the anastomosis which is formed between the ethmoidal arteries. As you can see here, anterior ethmoidal arteries, there is anastomosis from the sphenopalatine arteries, and the superior labile arteries, greater palatine arteries. So these are the important blood source of bleeding for the nasal septum. They are all forming an anastomotic network in the nasal septum, forming Kesselbach plexus. So this is the source of bleeding in this case. Okay, definitely. So that is the right answer. Okay, now, so this is a diagram which is showing you the openings in the lateral wall of the nasal cavity, and here you can see the opening in the sphenoethmoidal recesses is the sphenoidal air sinuses. This is important for you. Actually, one of the MCQ is from this topic only. In the superior meatus there is opening of posterior ethmoidal recesses. In the middle meatus there is the opening of bulla. At the level of bulla ethmoidalis, middle ethmoidal sinus, there is anterior ethmoidal sinus, maxillary sinus and frontal sinus. And in the inferior meatus there is an opening of nasolacrimal duct. And this is a posterior bleeding occurs if there is also a case of posterior bleeding which is occurring from the posterior aspect, that is from the Woodruff plexus. But here the bleeding stopped after silver cautery, so definitely this is a bleeding from Kesselbach plexus. Yeah, now let's move on to the next. Okay, a 16-year-old boy making a powerful moving out and starting blocks to begin a 100-meter sprint feels intense pain below his right knee and collapses to the ground. Unable to straighten his leg, the given plain film of the lateral knee reveals an avulsion fracture at the area indicated by the white arrow head. With the fracture fragment identified by the white arrow, which of the following structure is most likely detached in this condition? The condition, actually the correct answer is rectus femoris. How you are going to know the correct answer? Now here what you can see, the patella. The patella is involved, and we know that the person is not able. Now intense pain below the right knee and collapses on and not able to straighten his knee means the extension of knee is affected, and if extension of knee is affected, and we know that at the base of the patella the quadriceps femoris muscle inserts. So definitely here the involvement is towards the patella, and we know that quadriceps femoris muscle, okay, quadriceps femoris muscle which contains rectus. We know that quadriceps femoris muscle inserts into the patella. One is the rectus femoris. Other than that, okay dear, so rectus femoris. Other than that we have got vastus medialis, we have got vastus lateralis, we have got vastus intermedius, Okay, so actually these all are affected. So here at the base of the patella, the muscle which is detached will be the rectus femoris muscle. So that is the reason, and here in this diagram I want you to show these are the muscle together called as quadriceps femoris muscle, which is vastus medialis, lateralis and rectus femoris. All these are inserting towards the base of patella, and this was exactly involved in this case. Now I would also like to show you the other muscle. What were the other options given? I would also like to brief you about the other muscle which was given here. The other muscles which was given and is involved here. One was sartorius muscle. Now sartorius muscle is originating from anterior superior iliac spine and inserts to the pex anserine. If I talk about pex anserine, what is pex anserine? Pex anserine is located at the proximal medial aspect of tibia. So the muscles, actually there are three muscles. One is the gracilis muscle, one is semitendinosus, and one is sartorius muscle. This three muscle together is called as guy rope muscle, which is inserting onto the medial proximal aspect of tibia. Now if I talk about the gracilis muscle, it is one of the muscle of the pex anserine group which is inserting into tibia. Now the other muscle is tibialis anterior, which was given one of the option. So it originates from lateral shaft and condyle of the tibia and inserts at to the base of first metatarsal and the medial cuneiform, as you can see in the diagram. It is inserting into the medial, it is inserting into medial cuneiform and base of first metatarsal. So definitely this is also not the right answer. The right answer will be rectus femoris. Now coming to the next question. Okay, crudas of the diaphragm are musculotendinous bundles that arise from which of the following area? From posterior longitudinal ligament, from sternum, from bodies of lumbar vertebra L1, L2 and L3, renal fascia or psoas major. So which is the right answer, dear? Yes, sure. Okay, please okay dear. So just mark the right answer. Crudas of the diaphragm are musculotendinous bundle. Okay, sure. So what is the answers? So I am getting an answer from Dr. Aswadhama, and Dr. Aswadhama is absolutely right, and Pawar is absolutely right. The origin of bodies of lumbar vertebra, absolutely right, Mukesh. Yes, everyone is absolutely right. The correct answer is the bodies of lumbar vertebra L1, L2 and L3. So definitely yes, C correct answer है. Definitely आपके C correct answer है. C is the right answer. The origin of the crudas of the diaphragm is from the anterior aspect of L1, L2 and L3. So you can see this diagram. Actually, the right crux of the diaphragm originates from L1, L2 and L3 lumbar vertebra. Left crux from the first and second lumbar vertebra. Now let's talk about the next, that is question number 7. Which of the following correctly describes the flow of cerebrospinal fluid? So just go through all the option, dear. Just go through all the option and mark the right answer. Okay, so which is the correct flow of CSF? Which is the correct flow of CSF? So we can have 4 options as shown in the diagram, and you have to tell which of the following is the correct flow of CSF. So Hoping Traveller and Dr. Subhadeep Singh, Dokat, World Cricket, Hoping Traveller, Ankit Pandey, Kritan, everyone has given the right answer. It's from lateral ventricle. Yes, to interventricular foramen, to third ventricle, cerebral aqueduct, fourth ventricle, medial lateral aperture and the subarachnoid space. Absolutely correct. So here I would like to show this diagram. Actually, the maximum amount of CSF is produced by which ventricle? Maximum amount of CSF is produced by the choroid plexus of lateral ventricle. Yes, everyone is right, dear. No, it's C is the right, B is the right answer, dear. B is the right answer. Okay. So maximum amount of CSF is produced by lateral ventricle, choroid plexus of lateral ventricle. And from here, if you will see here, the choroid plexus of lateral ventricle is forming the maximum amount of CSF from here. So this is exactly the lateral ventricle. From here, it will go to the region of third ventricle via this interventricular foramen. Now from third ventricle, it will pass through cerebral aqueduct, and via cerebral aqueduct, it will reach the level of fourth ventricle, and via lateral and median aperture it will pass, there is an aperture in the roof of fourth ventricle, and then it will reach the subarachnoid space. So actually the whole table, if you want to know about the whole table how this happens, so this is a very relevant flow chart. Actually maximum amount of CSF fluid is formed by lateral ventricles, and from here it will pass through foramen of Monro and reach the third ventricle. From the third ventricle via cerebral aqueduct it will reach the fourth ventricle, and through the foramen of Mazendae and Luschka. What is foramen of Mazendae and Luschka? These are the openings found in the roof of fourth ventricle, and from here it will reach into the subarachnoid space and get absorbed into dural venous sinuses. It will get absorbed into dural venous sinuses. Got it? Now coming to the question number 8. Okay. Which of the following is true regarding stylomastoid foramen? Which of the following is correct statement regarding stylomastoid foramen? Which of the following is the correct statement regarding stylomastoid foramen? Your time starts now. Please mark the right answer. Okay. Okay, anyone? So the stylomastoid foramen, so actually we know that through the stylomastoid foramen, if we talk about, okay, D, yes, Mukesh, absolutely right. It's the correct answer is the stylomastoid branch of, correct answer is the stylomastoid branch of, absolutely correct dear. So correct answer is stylomastoid branch. So absolutely correct is the stylomastoid branch of posterior auricular artery. Yeah, D, Mukesh is absolutely right. Actually, when stylomastoid foramen, I would like to show you, it is exactly the stylomastoid foramen is located close to the styloid process of the temporal bone and the mastoid. So in between the styloid process, this is the styloid process of the temporal bone, and this is the mastoid process, and in between styloid and mastoid process, this small foramen is the stylomastoid foramen. So I would like to show you one more diagram here. So you can AD bola tha, okay, hoping, okay, sure. So see here, this is exactly the foramen. Okay, the yellow color arrow is exactly at the foramen. This is the mastoid process. This is the mastoid process, and this is the styloid process, and in between styloid process and mastoid process, what we are seeing is the stylomastoid foramen. Two important structure passes through the stylomastoid foramen. Which two structures? That is important for MCQ. The two structures passing through stylomastoid foramen is facial nerve and stylomastoid artery. Facial nerve and stylomastoid artery. So definitely stylomastoid branch of posterior auricular artery is traversing through it. That C is the correct, and D is the correct answer. Okay, dear? Yes, Mukesh, absolutely correct. So that is D is the correct answer. Now let's move on to the next. A 59-year-old woman recently has a pelvic surgery during which cancerous lymph nodes were removed from the lateral pelvic wall. During a post-operative examination, she says she has been having a painful muscle spasm in her thigh. Which of the following muscle is most likely involved? The muscle involved is the sartorius muscle, biceps, tensor fascia lata, or gracilis. So hoping traveler is absolutely right. D. D is the right answer. Yes, ma'am, D, hoping traveler. Yes, Himansu, D is the right answer. And why I will tell you, because pelvic surgery is performed and lateral wall of pelvis is involved, and we know through obturator foramen, the nerve which is exactly located here will be the obturator nerve, and we know that obturator nerve is the nerve of medial compartment of the thigh. So obturator nerve is the nerve of medial compartment of thigh. So yes, D is the right answer. Here in this diagram you can see obturator nerve passing through the, so is over the psoas major muscle, crosses the sacroiliac joint, and then it is traversing into the lateral pelvic wall, and it is giving innervation to the muscles of, the medial compartment of the thigh. So definitely we know that gracilis is one of the muscle of medial compartment of thigh, so that will be the right answer. Okay. So I would also like to show you this diagram. Here in this diagram you can see here the obturator nerve. This is the obturator nerve, and exactly what you can appreciate in this diagram, that obturator nerve is passing through obturator foramen. So this is exactly the obturator foramen, and obturator nerve is traversing through the, this is the obturator nerve. This is exactly the obturator nerve, and this obturator nerve is passing through the obturator foramen. Okay, this is passing through the obturator foramen. So as you can see here, the obturator, so this is the right answer. Here you can see here the other branches of the lumbar plexus, iliohypogastric, ilioinguinal, genitofemoral, lateral cutaneous nerve of thigh, and obturator nerve, which is lying medially. So on the lateral pelvic wall, more medially, the nerve which is lying is the obturator nerve, and obturator nerve is the right answer. So we will go with gracilis as the right answer. If I talk about the sciatic nerve, it is giving innervation by its two component. Okay, it is having two components. One is it is giving innervation to, it is having a common peroneal nerve component and tibial nerve. Common peroneal nerve component is giving innervation to short head of biceps, and the tibial component is giving innervation to semimembranosus, semitendinosus, long head of femoris and adductor magnus. So definitely here, if I have to mark the best answer, I will go with gracilis as the right answer. Now let's go to the next one, that is question number 10. So here also, okay, firstly read, then mark the right answer. A 60-year-old woman develops hiatal hernia in which fundus of the stomach protrudes through esophageal hiatus in the diaphragm into the thorax. So which of the following structure is at the greatest risk during the repair? So actually this is a very easy one, because definitely it is mentioned that esophageal hiatus is involved. Esophageal hiatus is at the level of T10 and through it vagus nerve passes. Yes, it's an easy one. We know that diaphragm is having openings like vena cava opening, it is having esophageal opening, it is having the aortic opening. So if I talk about the esophageal opening, so definitely the structures traversing is the vagus nerve. So here we can see right and the left vagus nerve will traverse and will change into the right vagus, and left vagus changes its name to the posterior and the anterior vagal trunk. And yes, definitely it is important to know the major openings of the diaphragm and structures traversing through it. So if I talk about that foramen of Morgagni, so actually these are the major openings. So three major openings are there in the diaphragm. So vena cava opening is at the level of T8, esophageal opening is at the level of T10, aortic opening is at the level of T12, and we have to know the important structures passing through it. So if I am talking about esophageal hiatus, the structures, the important structure which traverses through it is esophagus, anterior and posterior vagal trunk, esophageal branch of the left gastric artery, aortic hiatus, the aorta, azagus and thoracic duct. Minor apertures are there for the greater, lesser and splanchnic nerves. Foramen of Morgagni or Lare, which is lying anteriorly near the sternum. There is a gap between the origin. There is a gap between the origin of the sternal, between the xiphoid sternal origin and that of 7th costal cartilage, and the structures traversing is superior epigastric artery and vein. So now let's talk about the next one. All of the following are example of traction epiphysis except. All of the following are example of traction epiphysis except. All of the following is the example of traction epiphysis except. All of the following are example of. So I got an answer from yes, D is absolutely right answer, absolutely. If I talk about deltoid tuberosity, what is this? This is located, can you tell me deltoid tuberosity is located in, can you tell me deltoid tuberosity is located in the epiphyseal region or the diaphysis region? So epiphysis or diaphysis region, can you tell me? Deltoid tuberosity, which is an example of traction epiphysis, so it is located in the epiphysis, it is located in the epiphyseal region or diaphysis. It is located in epiphyseal region or diaphysis. Okay, diaphysis, yes. So this is right. Kirtan Kansara is absolutely right. Hoping Traveler is also right. So deltoid tuberosity is lying in the shaft. So it is lying in the diaphysis part, and we know that epiphysis, type of traction epiphysis, pressure epiphysis, we have got aberrant epiphysis, we have got atavistic epiphysis. So that will be located at the ends of the bone. So definitely deltoid tuberosity is lying in the shaft. It is in the diaphysis region. So this is the correct answer. Yes, that is absolutely right. This is deltoid tuberosity, which is located in the shaft of the humerus bone. So it is located in the diaphysis part. It is located in the in the diaphysis part of the long bone humerus, so it's not an example of epiphysis. So different kinds of epiphysis are there. For example, traction epiphysis are those kind of epiphysis which is not present at the articular end. They are not involved in formation of joint, but they are involved and formed by the traction of muscle tendons. Unlike pressure epiphysis की बात करेंगे तो pressure epiphysis are involved in forming the joint. They are involved in forming the joint, and they are involved in forming the joint, and they are involved in weight transmission. Deltoid tuberosity is present on diaphysis, so that is not an example. Traction is generally by the pull of muscles and tendons, so that kind of epiphysis traction. So see here in this diagram you can see the example of traction epiphysis. This is the pressure epiphysis which is involved in forming the joint, and it is involved in weight transmission. So head of femur. Traction epiphysis like lesser and greater trochanter, example of traction. Atavistic means they are actually a part of one single bone, but in lower animals they are a separate bone. We have got two examples of atavistic: posterior tubercle of talus, ostrigonum, and cocoid process of scapula. Aberrant means abnormal location, and the epiphysis present at the head of first metacarpal is an example of aberrant epiphysis. Now let's go to the next one, that is question number 12. During an attempted suicide, a depressed young woman slashes her wrist, with a straight razor. She cuts just proximal to the pisiform bone to the depth of superficial aspect of flexor retinaculum before passing out at the site of her own blood. As a result of this wound, she may be suffering from neuromuscular deficit. Which of the following is the right answer? Question number 12. Amitas is telling D. So yes, actually I will tell you, she cuts proximal to pisiform, close to pisiform, and she cuts the flexor retinaculum but superficially, superficial aspect of flexor retinaculum. That means they are injuring which nerve? Ulnar nerve. So ulnar nerve is injured, and we know that adductor pollicis is getting innervation from, and we know that adductor pollicis is getting innervation from ulnar nerve, and so that is the reason the adduction is not possible, and inability to adduct the thumb is the right answer. So here I want you to show this diagram where you can see the flexor retinaculum has been clearly shown, and you can see the ulnar nerve. The ulnar nerve is located close to this bone and this bone. So what are these bones? This is the pisiform. So this is pisiform, this is the pisiform, and this is the hamate. Pisiform and hamate. So we have got pisiform and hamate, and we know that this is the flexor retinaculum, and median nerve is passing superficial to flexor retinaculum close to pisiform. So definitely median nerve is the right answer. So definitely median nerve is the right, so definitely ulnar nerve is the right answer. If I talk about median nerve, see here, this is the median nerve, and median nerve is passing deep to flexor retinaculum. So if there is a deeper injury, then only median nerve is involved. Ulnar nerve, ulnar artery are more superficial injury. They are medially located close to pisiform bone. So here ulnar nerve is injured, and we know that ulnar nerve, if you will see pisiform and close to this, the ulnar nerve and ulnar artery rise, and ulnar nerve is giving innervation to most of the muscles of the hand. So it gives innervation to hypothenar muscle, it gives innervation to adductor pollicis muscle, it gives innervation to flexor carpi ulnaris, it gives innervation to medial lumbricals and all the interossei muscles of the hand. So definitely here adduction of the thumb is affected due to injury to adductor pollicis muscle, Question number 13. A 50-year-old male is brought to the emergency department by the ambulance after having been in a traumatic accident. He complains of abdominal and pelvic pain. The abdomen was found to be tender to palpitation in all the four quadrants. Genitourinary examination shows severe ecchymosis in the perineum, and fresh blood is seen in the urethral meatus. Radiological examination reveals fracture of multiple fracture of pelvis, and a retrograde urethrogram was performed, and the membranous urethra is injured. So where is the dye and the fluid accumulated? So that is so actually the correct answer is extraperitoneal space. Dear. So yes, I have blocked that person. Okay, so yes. So here extraperitoneal space, actually there is two types of injury in the urethra which is quite common. One is membranous urethra and the other is, one is membranous urethra and the other is the bulbar urethra and penile urethra. Yes. So if yes Mukesh, so if there is an injury to the bulbar urethra or penile urethra, the accumulation of fluid will be in the superficial perineal pouch. But if there is an injury into the deeper aspect in the membranous urethra, there will be injury in the extraperitoneal space. There will be injury in the extraperitoneal space. So that is the accumulation of the fluid. So if there is an injury in the membranous urethra, if the injury is in the membranous urethra, accumulation of fluid is in the extraperitoneal space, is in the extraperitoneal space. And if there is an injury to the to that of the penile or bulbar urethra, the accumulation of fluid is in the superficial perineal pouch. So for that I would like to show you this diagram. Here you can see the injury. The first diagram which you are seeing is the injury of the bulbous urethra, and the fluid has accumulated below scarpa and in the superficial perineal space. But in the case of injury to the membranous urethra, extravacation of the urine or blood will be occurring in the extraperitoneal space. Actually you can see this diagram, and here extravasation of urine when there is a rupture of bulbar urethra is the urine accumulated or any kind of fluid accumulated in the superficial perineal pouch, but in case of membranous urethra it will be in the extraperitoneal space. So that difference is must for you to know. Now let's talk about the next, that is question number 14. A 35-year-old man is admitted to the hospital with an indirect inguinal hernia, and during an open hernioplasty, in contrast to laparoscopic procedure, the spermatic cord and the internal abdominal oblique muscle was identified. Which component of spermatic cord is derived from internal oblique muscle? So very easy, you have to tell me the structure derived. Question number 14. So Sanjay is telling it's B. So here they are asking the internal oblique muscles, internal abdominal muscle is giving rise to which of the following component? Dr. Sudeep Singh, yes, cremaster muscle is the right answer, absolutely correct, yes. So here I want you to tell that external oblique muscle is forming, if I talk about external oblique muscle, it is forming external spermatic fascia, internal oblique muscle is forming cremaster muscle and fascia, and transverse abdominis muscle is not forming any layer, fascia transversalis is forming internal spermatic fascia. Okay Puneet, okay, definitely. Yeah, because of that everyone is, okay, let me just come to that. Yeah, definitely I think that was for your answer to be key to be given to you, that was the thing, so don't worry. Yeah, okay, definitely dear, that was the key which was given for your examination point of view, so definitely that is the right one. Okay, don't worry, I will just okay, let's move. Okay Mukesh, yeah Mukesh, it's okay. So we were in which MCQs, let me just check. Okay, yeah, so we have done with this. Yeah, cremaster muscle, question number 14. Yeah, cremaster muscle, is it okay Dr. Puneet? Yeah, okay. I have blocked that person also. Yes, it's okay. So cremaster muscle, this is an easy one, and you can see this is the diagram showing the contents of spermatic cord. This is the diagram showing contents of spermatic cord, and here you can see in the spermatic cord we have got ductus difference, we have got cremaster artery. So we have got ductus difference, we have got cremaster arteries, we have got artery too. So it's also important for you to know the content of spermatic cord. Important contents of spermatic cord has been given in this image. The important contents of spermatic cord will be ductus deferens, artery to ductus deferens, cremaster artery, testicular artery, pampiniform plexus of vein, processus vaginalis. Okay, so let's move on to the next. So question number 15, a 56-year-old man is diagnosed with midgut volvulus and intestinal ischemia. A laparotomy is performed to release the obstructions of the intestine. So which of the following structure is used as a landmark to determine the position of duodenojejunal junction? Okay, so I got an answer from Kansara. What about the others? What about the others? Yes. So if I talk about, so let me just check. Okay, so I got C, no, vasa recta, no dear. Dr. Sudeep Singh is telling D. D is the right answer. Yes, Mukesh Chandra, suspensory ligament of Trich. So here what happens, if you will see here, so here what happens, there is so here the structure landmark used for the position of duodenojejunal junction. So suspensory ligament of duodenum or tris. So that is important, suspensory ligament of duodenum or tris. That is exactly the location where, that is exactly the location which is giving attachment to that of duodenojejunal junction. So you can see here, this is ligament of Trich, and the ligament of Trich is attached to the right crux of diaphragm, and it is lower down attached at the junction of duodenum and jejunum. So that is not letting the the descent of duodenojejunal junction. So absolutely correct. Oh yeah. The phrenicocholic ligament, please don't confuse with that. If I am talking about phrenicocholic ligament, it is giving indirect support to the spleen. It is giving indirect support to the spleen because it is, if you will see this diagram, this is phrenicocholic ligament which is inferiorly attached to the colon and the diaphragm, and you can see it is preventing the descent of the spleen into the left downward region. So we will go with that as the right answer. Now can you tell me, the third part of vertebral artery is related to which structure? The third part of vertebral artery is related to which structure? Question number 16. The third part of vertebral artery is related to which structure? Okay, I got an answer. Yes, Kansara. Okay, Puneet, Hindi. Okay. किस पे रिलेशन होता है, मीन्स थर्ड पार्ट ऑफ वर्टिब्रल आर्टरी कौन से स्ट्रक्चर से रिलेटेड होता है? विच? Posterior arch of atlas is absolutely right answer. Yes, posterior arch of atlas is absolutely the right answer. Posterior arch of atlas is, actually this is telling you, if we are telling about the third, okay, sure dear, अगर हम third part of vertebral artery की बात कर रहे हैं तो it is located in suboccipital triangle. थर्ड पार्ट ऑफ वर्टिब्रल आर्टरी की बात कर रहे हैं तो ये कौन से ट्रायंगल में रहता है? पोस्ट सब ऑक्सीपिटल ट्रायंगल. सो आपको सब ऑक्सीपिटल ट्रायंगल की बाउंड्रीज और कंटेंट जाननी है. सो सी हियर, दिस इज एग्जैक्टली द फ्लोर स्ट्रक्चर. दिस इज शोइंग यू द फ्लोर स्ट्रक्चर ऑफ सब ऑक्सीपिटल ट्रायंगल. Floor structure of suboccipital triangle, and you can see here in the floor or as a content हम देखें तो content जो most important content होता है suboccipital triangle में वो third part of vertebral artery होता है. और आप देख सकते हैं third part of vertebral artery is resting over posterior atlanto-occipital membrane and that of posterior arch of C1. Okay. So exactly, if you will see, third part of vertebral artery is located over posterior atlanto-occipital membrane and over the posterior arch of C1 cervical vertebra. So we will go with posterior arch of first cervical vertebra as the right answer. Now while exposing the kidney from behind, which of the following nerves is affected? Which is not affected? Which of the following nerve is not liable to be affected? Is not liable to be affected. 'Is 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 not liable to be affected. ' Okay. Okay, so what is your answer? Please mark the right answer, dear. Please mark the right answer. So yes, 17A. I got an answer 17A. Okay, 17A is, they are telling us 17A as the right answer. Let me just check. Lateral cutaneous nerve of thigh is absolutely right. Punit, you are absolutely right. Putin is, you are absolutely right. Lateral cutaneous nerve of thigh is absolutely the right answer, dear. Yes, it's the right answer. Yeah. So actually when you expose the kidney from posterior aspect, you will see it is related to nerves, subcostal nerves, iliohypogastric, ilioinguinal nerves, and it is related posteriorly with the muscles, psoas major, quadratus lumborum and transverse abdominis muscle, but not related with lateral cutaneous nerve. So yes, that is the diagram showing the posterior. This is a diagram showing posterior relation of kidney. Okay, so what you can see posteriorly, if you will see the relation of structures, so posterior relations of the kidney structures, you will see we will have subcostal nerves and vessels, we will have iliohypogastric, ilioinguinal nerves, and also we will have the transverse abdominis muscle, the quadratus lumborum and psoas major. Okay, now identify the encircled structure in the given image. Identify the encircled structure in the given image. Identify the encircled structure in the given image. All of you, question number 18. I got an answer from Kritan Kansara. What about others? (70-30) os trigonum. Os trigonum is the right answer. Yes, if you will see the posterior aspect, actually posterior tubercle or posterior aspect of talus, this os trigonum and coracoid process of the scapula, these are the two examples of the atavistic, these are the two examples of atavistic epiphysis, and os trigonum is the right answer. Yes, os trigonum, world cricket, absolutely Mukesh, right answer. So it is an accessory talus. So you can see here, this is exactly the example of this. Os trigonum becomes an example of atavistic epiphysis, because in lower animals this is the part of another bone, but it is, in case of human beings, it has been fused with the bone like talus or the. So there are two examples of atavistic epiphysis. One is that of the os trigonum, another is coracoid process of scapula. So this is exactly showing you os trigonum. I would like to show you so many images. Here also you can see the talus bone is there, and talus bone is having the posteriorly, if you will see, there is posterior tubercle that is forming os trigonum. So this is exactly showing you the images of talus and calcaneum they are articulating. So here you can see, okay, the other options which were given. If you will talk about the other option like trochlear, tally, ankle motize and lateral tubercle. So I have included that diagram. So this is the diagram of talus showing the talar dome. This is showing the talar dome. And they are also showing the parts of the talus bone, lateral and medial tubercle. This is the diagram showing you the talus articulating with the calcaneum, and this is showing you the motice. What do you mean by the motice? The motice means, if you will see here, the lower end of the fibula, that is called as lateral malleolus, and the lower end of tibia, which is called as medial malleolus, is articulating with the superior aspect of the talus. This is forming the motice. So this is exactly called as the tibiofibular motice. Now coming to the question number 19. In a road traffic accident, a 35-year-old male sustained severe neck injury at C6 level. In addition to crushing the spinal cord, the left transverse process of C6 cervical vertebra is fractured. So which of the following is endangered? Which of the following structure is endangered? Question number 19. Yes, absolutely right. The correct answer is D, vertebral. Yes, absolutely right, Mukesh and everyone. Absolutely right. This is the correct answer is vertebral. Yeah. So actually we have knowing that vertebral artery is having is having course, it is having 4 parts. It is having 4 parts, part 1, part 2 and part 3 and 4. So actually if you will see, this is the entire course. So subclavian artery, the first part is residing in scaleno-vertebral triangle. पहला वाला जो पार्ट है वो स्केलिनो-वर्टिब्रल ट्रायंगल में रिसाइड करता है. दूसरा वाला पार्ट है फोरामेन ट्रांसवर्सेरियम, फोरामेन ट्रांसवर्सेरियम में रिसाइड करता है. थर्ड पार्ट ऑफ वर्टिब्रल आर्टरी इज रिसाइडिंग इन द सब ऑक्सीपिटल ट्रायंगल and fourth part is residing in foramen magnum. So third part of vertebral artery in suboccipital triangle. So we can clearly see, अगर हम बात करेंगे cervical vertebra के ट्रांसवर्स प्रोसेस से रिलेशन का, तो ट्रांसवर्स प्रोसेस के रिलेशंस में C6 cervical vertebra fractured है, तो which artery is going to be fractured or involved is the vertebral artery. Absolutely correct. Other than that, this is showing you the vertebral arteries of two sides will join together to form the basilar artery, and also showing the circle of Willis located into the interpeduncular cistern. This is showing you the branches of the arch of aorta as the innominate subclavian artery giving vertebral artery. So this diagram is showing you that the vertebral artery is the branch of first part of subclavian artery. Vertebral artery is the branch of first part of subclavian artery. Vertebral artery is the branch of first part of subclavian artery. Okay. Now let's coming to the question number 20th. A 42-year-old male was having a 42-year-old male. A 42-year-old male is having a complaint of severe pain in the lower abdominal region. The pain starts in the loin region, radiate down the groin. Recently, he was diagnosed with ureteric stone and examination in the nephrology department. What do you think is the most liable site of stone to get impacted in the ureters? Question number 20th. Mukesh, point of crossing of ureter by ductus deferens. So the main thing is that this is a male person, so no need of the uterus being the answer. Uterine artery is not there, while tip of transverse is not. The most correct answer is D, point of crossing by the ductus deferens. So actually it is important for you to know the ureteric constrictions levels, and ureteric constrictions levels I would like to show you a diagram for that. So here you can clearly see, if I talk about this, you can clearly appreciate that at the junction of pelvic ureteric junction at the pelvic brim, and when the other important point is crossing. So you can see these are exactly showing you the important area where the ureter can be constricted. So crossing by vas deferens when it is passing through the broad ligament at the pelvic brim, at the pelvic ureteric junction. These are the common side where there can be the constrictions, and there can be the constrictions by the important structures which is crossing it, and this can be the level of ureteric constriction. So definitely the correct answer is vas deferens crossing the ureter. So here also you can see pelvic ureteric junction, pelvic brim, uretrovesical junction, and the important answer here is the vas deferens crossing. Now question number 21. Question number 21, please mark the right answer. Question number 21, I am talking about question number 21. So you can write like this, 21 answer D, so that I will not get confused that whether that is, so I am getting an answers like, okay, I have shown you that diagram also, the structures opening into the different meatus and all. Okay, so here ethmoidal, yes Mukesh, you are absolutely right. Ethmoidal air sinus, also Mukhtar and Dr. Sudeep Singh are absolutely right. Yes, the correct answer is Dr. Aswadhama, absolutely correct. This the 23-year student, 23-year students presents to the OPD with that of OPD with nasal discharge, and definitely yes Kansara, you are absolutely right. The discharge from superior meatus, so superior nasal meatus, posterior ethmoidal sinus opens. Let me show you. So it is also important for you to revise all the structures opening in different spaces of the lateral wall. So opening in the inferior meatus is the nasolacrimal duct. Opening into the sphenoethmoidal recesses is sphenoidal air sinus. Opening in the superior meatus, which has been asked in this MCQ, is posterior ethmoidal air sinus, and opening in the middle meatus is bulla ethmoidalis, middle ethmoidal air sinuses, and here I am just below it maxillary sinus, anterior ethmoidal sinus and frontal sinus. So that is absolutely correct. Let's move on to the question number 22. A 34-year-old female presents to the emergency room after falling in the bathroom. She complains of wrist pain and numbness in her right palm. Based on her symptoms, you suspect that she has dislocated lunate bone in the wrist. Identify the lunate bone in this X-ray. Identify the lunate bone in this X-ray. Dr. Putin is telling it's D. What about others? What about others? Aswathama is telling it's C. Okay. No, we have to, based on symptoms, lunate bone, identify lunate bone. You have to identify lunate bone, dear. You have to identify lunate bone. In this case, you have to identify lunate bone. Lunate bone, and lunate bone is D, dear. Lunate bone is D. So D is the right answer. Lunate bone is D. So we will go with D as the right answer. See here how you are going to identify it. So you can clearly see this is the radius, no doubt about this. This is radius and this is ulna. So which is the most lateral bone? So C will be the scaphoid, D will be the lunate, and this will be the pisiform and tricuteral. Okay. And then as you go from lateral, there will be trapezium, trapezoid, capitate and hook of Hammett. Got it? So definitely you will have the D as the right answer. If you want to see more clear picture, you can definitely, D is the bone which is articulating with the radius. So D is the lunate bone. So if you want to have a clear picture, see here, I will show you this diagram. How you are going to identify whenever such kind of image is given to you. Firstly, you identify the radius bone and then the ulna bone. So when you have got the radius bone, you are knowing that which is the lateral and which is the medial. So then you can see the articulation, you can appreciate articulation of scaphoid and lunate is with the radius bone. Tricuterum and pisiform is like, actually pisiform is sitting over the tricuterum. No, all question answers is not D. No, it's not like that. No, it's not like that. Okay, now coming to the second row, trapezium, then we have got trapezoid, then we have got the capitate, and then we have got the Hammett. Okay, now let's mark the right answer here. Question number 23. Just a minute. Yeah. Question number 23. In respect to the movement of arm at glenohumeral joint, which of the following movement is correctly marked with its, yes Adil, yes dear Adil, yes, you can mark the right answer. So you can tell me which is the right combination of muscle and the movement. Can you tell me the answer? So which is the right combination of the muscles and the movements? Extension is done by deltoid posterior part, abduction pectoralis major latissimus dorsi, adduction deltoid, medial rotation infraspinatus. So Dr. Sudhip Putin is telling A, and what about Dr. Sudhip Singh? A and C. So actually I will tell the answer by explaining the action of all the muscles. So yes, A is the right answer. See here extension, actually deltoid, this is wrong. So let me explain other way also. Adduction is done by deltoid, no, it is the abduction. Abduction is done by pectoralis major latissimus dorsi, no, it is adduction. Medial rotation by infraspinatus, no. Lateral rotation. Lateral rotation by subscapularis, no. Medial rotation. Actually, extension is done by the posterior fibers of deltoid. That is the right answer. If I talk about deltoid action, you can note down deltoid muscle action. So you can write on anterior fibers of deltoid, which is also called as the clavicular part. It is causing, if I talk about anterior part, it is causing flexion, okay, and slight medial rotation also. Middle part, middle fibers or acromial fibers of deltoid are the prime abductors of the shoulder joint. And if I talk about the posterior part or that of the spinous part of deltoid, they are causing extension. They are primarily causing extension and slight lateral rotation. So you can see deltoid is causing so many actions. As you can see, deltoid is performing many actions. Its prime action is, you know that its prime action is abduction, which is done by acromial. Its prime action is abduction, which is done by acromial or middle fibers. Anterior fibers will cause flexion and medial rotation. Posterior fibers will cause extension and lateral rotation. Now question number 24. Okay, a 24-year-old mountain climber presents to emergency room with shoulder pain following a fall. He was climbing a cliff nearby National Park where he lost his grip and fell approximately 5 meters into the boulders below. He says landed on his right arm and heard the bone snap. Inability to extend the wrist. What is the structure involved? When there is a keyword given, inability to extend the wrist. Can you tell me if there is inability to extend the wrist, so which structure is involved? Which structure is involved if there is inability to extend the wrist? If there is inability to extend the wrist, this is quite clear that the structure being involved will be the radial nerve. The structure being involved will be the radial nerve. And we have to know that radial nerve always runs along with profunda brachii artery. So radial nerve runs with the profunda brachii artery. So deep brachii artery is the right answer. Actually, profunda brachii artery, other name is absolutely correct, Dr. Kritan Kansara. So we know that deep artery, if I am talking about the deep artery of the arm, the other name of deep artery, deep brachial artery is profunda brachii artery and runs along with the radial nerve. This is the radial nerve and the deep artery of arm, which is related in the radial groove. And so other is not the right answer, because anterior posterior circumflex humeral artery is injured in the fracture of surgical neck, and common interosseous artery is again giving many branches, the anterior posterior interosseous artery in the lower part of the humerus. So bicipital, if I talk about brachial artery, it courses anteromedially in the bicipital groove, and here we can see the branches. In this diagram you can see the branches of brachial artery and profunda brachii artery. Brachial artery, one of the important branches, profunda brachii artery, which is related in the radial groove. Question number 25. A 56-year-old man comes to the emergency department because of persistent left wrist pain. While walking, his dog 5 hours ago fell forward to the ground and landed on outstretched left hand. Examination shows mild swelling over the dorsum of the left hand with perceived range of movement. There is a point of tenderness over anatomical snuff box. So X-ray is showing you as shown below the fracture site. So which of the following is the complication? So Dr. Subdeep Singh Kritan Kansara is telling A as the right answer. Okay, A as the right answer. Yes, so the correct answer is avascular necrosis, and the most characteristic feature which was mentioned here was anatomical snuff box tenderness. यहाँ पे जो mentioned है वो anatomical snuff box का tenderness mentioned है. So clearly if anatomical snuff box is involved, we know that this is a case of fracture of scaphoid bone, and if there is a fracture of scaphoid bone, so definitely the complication seen in the scaphoid bone fracture is avascular necrosis. Yes, because of retrograde blood supply. Absolutely correct dear, absolutely correct. Absolutely correct. Absolutely correct, dear. Yes, why not A? A is the right answer. Dr. Putin, why A? Avascular necrosis is the right answer. See here, anatomical snuff box. Now see, the anatomical snuff box is involved, and what is lying in the floor of anatomical snuff box? Anatomical snuff box. Floor contains scaphoid bone. Trapezium is also there, but it contains scaphoid bone. Anatomical snuff box floor contain scaphoid bone, and scaphoid bone is very peculiar in its blood supply. Okay, so Putin, are you understanding this? 25 A, because it's an anatomical snuff box, and we know that in anatomical snuff box the bone which is forming the floor is the scaphoid bone. And if you will enlarge this image, you can see again this is the radius and this is the ulna. So you can clearly appreciate here in this diagram the bone which is fractured is this bone, and what is this? This is the scaphoid bone. This will be the lunate, this will be the triquetral, and this will be the pisiform, and this will be triquetral. This is the trapezium and this is the trapezoid. This is capitate and this is the hamate bone. Got it? So clearly what is involved is this, what is fractured is the scaphoid, and we know that scaphoid bone is having a particular blood supply from the posterior aspect. So the dorsal, so here the blood supply is from the dorsal aspect, that is mainly the dorsal scaphoid branch will supply the scaphoid bone entering from the dorsal aspect, and if treatment is not done, it can lead to avascular necrosis. In this diagram you can see the dorsal scaphoid branch which is reaching to the scaphoid bone and fracture the blood from retrograde direction, and that is the reason of complication seen in case of scaphoid fracture, that is avascular necrosis. Done. The other are not right answers because carpal tunnel syndrome is median nerve, compartment syndrome is for the closed space infection, Dupuytren contracture is a contracture of the hand in case of the whole contraction, means it's in a contractured way mainly seen in the person performing a particular kind of work. Osteomyelitis is also not right because osteomyelitis, if I talk about osteomyelitis, it is seen in case of infection via bacteria. So definitely these are not the right answer. So let's move on to the next set of MCQs, that is 26 to 50. Okay, so let's move on 26 to 50. So that would be, so all the best for the next set of MCQs. So let's move on to that. Okay, so let's start with that. So I will just go through this and we will start. So that you will not get any hint for the marking the right answers. Okay, let's start with 26 questions. Okay, so let's start with the question number 1. Question number 26. So which of the following option is correctly labeled? Which of the following option is correctly labeled in this diagram? Okay, so everyone, Dr. Putin has given the answer. What about which of the following option is correctly labeled? So in this diagram you can see the scalp layers and the meningeal layers has been marked. So you can tell me the correct option in correlation. Okay, so can you tell me what is A? What is A? So let's go like this, so that what is 1? What is 1, dear? What is 1? What is 1? It is the aponeurotic layer. It is the aponeurotic layer of the occipitofrontalis muscle belly. Okay. So what is 2? Epicranial and arachnoid. Okay, Mukesh Chakra. Okay, so actually what happens, if you will see this, this is the pericranium part, cranium part. This is the dura, this is the dura, this is the dura mater, and this is the arachnoid. A for arachnoid matter and this is P for pia mater. So exactly this is the labeling done. So definitely we will go with A as the right answer. Okay, so the layers has been mentioned here. Here you can see the scalp, and then we have got epicranial aponeurosis. Why epicranial aponeurosis? Because here you can see this muscle belly. So anteriorly this is the frontalis muscle belly, and posteriorly there will be occipitalis muscle belly. So this is the epicranial aponeurosis. Then we have got the perosteum, loose connective tissue. Then we have got the cranium, pericranium, and then we have got the dura, arachnoid, and that of the pia mater. So we will definitely go with that as the right answer. Now coming to the next one, that is question number 27. So all of the following statements is correct regarding the mark structure in the image except. Brijesh is telling C. So which is the marked cavity here? Which is the marked cavity here? Which cavity is this? So this is a coronal section of the brain. ये जो diagram आप देख रहे हैं, that is the coronal section of the brain. So I am getting answers B and C. All of the following statement is correct except we have to mark the wrong statement. So can you tell me which ventricle is this? Which ventricle is this? Whether it is the lateral ventricle, third, fourth, or which ventricle is this? Can you tell me which ventricle is this? Okay, okay, Mukesh. So no, B is the right answer. Actually, B is the right answer. No, this is the third ventricle. This is the lateral ventricle. Yes, this is the lateral ventricle. Sorry, this is the lateral ventricle. And lateral ventricle, if you will see, is communicating with the third ventricle via interventricular foramen of Monro. So lateral ventricle communicate via interventricular foramen of Monro to the third ventricle, yes, that is right, that this is the lateral ventricle. We know that lateral ventricle communicate with the third ventricle through interventricular foramen of Monro. This cavity is seen. So when you see the cavity of the coronal section also, you can see a well defined cavity, and you know that I am showing you just the similar kind of diagram here. If you will see the similar kind of diagram here, what you can appreciate in this diagram, so definitely the lateral ventricles has been shown to you, and you can clearly see in this diagram that lateral ventricle is forming a communication. So this is the lateral ventricle, and this will form communication with the third ventricle via interventricular foramen of Monro. Now I just want to show you this diagram where you can see another view, and you can understand how the outline of lateral. So these are the two lateral ventricles. This is entirely the whole of the lateral ventricle, one on the right side, another on the left side. Okay. ये जो डायग्राम आपको दिख रहा है, उसमें आपको कौन सा वेंट्रिकल दिख रहा है? लेटरल वेंट्रिकल दिख रहा है. क्या है? ये लेटरल वेंट्रिकल है. कौन सा वेंट्रिकल है? ये लेटरल वेंट्रिकल है. और अगर अब मैं बात करूँ तो लेटरल वेंट्रिकल कम्युनिकेट करता है थर्ड वेंट्रिकल से. ये कौन सा वेंट्रिकल है? थर्ड वेंट्रिकल है. ठीक है, ये थर्ड वेंट्रिकल है, और लेटरल वेंट्रिकल और थर्ड वेंट्रिकल कम्युनिकेट करता है इंटरवेंट्रिकुलर फोरामेन ऑफ मुनरो. ठीक है, और थर्ड वेंट्रिकल कम्युनिकेट करता है सेरिब्रल एक्यूडक्ट से फोर्थ वेंट्रिकल में. अगर मैं बात करूँ कम्युनिकेशन का, थर्ड वेंट्रिकल विच इज कम्युनिकेटिंग विद द फोर्थ वेंट्रिकल, दैट कम्युनिकेशन ओकर्स वाया एक्यूडक्ट ऑफ सिल्वस, सेरिब्रल एक्यूडक्ट ऑफ सिल्वस. ठीक है, एवरीवन, डॉक्टर मुकेश, एवरीवन, अभी अभी अंडरस्टैंड हो रहा है? लैटरल वेंट्रिकल कम्युनिकेट करता है थर्ड वेंट्रिकल से इंटरवेंट्रिकुलर फोरामेन ऑफ मुनरो, और थर्ड वेंट्रिकल कम्युनिकेट करता है फोर्थ वेंट्रिकल से वाया सेरेब्रल एक्यूडक्ट। ओके, अभी हमें क्या जानना है? द रिलेशंस ऑफ डिफरेंट पार्ट ऑफ लैटरल वेंट्रिकल। सो दिस इज द रिलेशंस ऑफ द सेंट्रल पार्ट। अगर आप ये लैटरल वेंट्रिकल देखोगे तो यहाँ पे जब लैटरल वेंट्रिकल देखेंगे तो इसका ये एंटीरियर हॉर्न है, ए फॉर एंटीरियर, ये इसका बॉडी या सेंट्रल पार्ट है, ये इसका इंफीरियर पार्ट है, ये जो आप देख रहे हो ये इसका इंफीरियर पार्ट है, इंफीरियर हॉर्न है, और ये इसका पोस्टीरियर हॉर्न है। मीन्स लैटरल वेंट्रिकल को हम 4 पार्ट में डिवाइड कर सकते हैं। ओके, 4 पार्ट में डिवाइड कर सकते हैं। एक इसको एंटीरियर हॉर्न बोलते हैं, जो इसका पार्ट पोस्टीरियरली ऑक्सीपिटल लोब ऑफ ब्रेन में रहता है उसको पोस्टीरियर हॉर्न बोलते हैं, जो टेम्पोरल लोब में रहता है उसको इंफीरियर हॉर्न बोलते हैं, और जो आपका मेन पार्ट है जो आप देख रहे हो उसको बॉडी या सेंट्रल पार्ट बोलते हैं। तो दिस इज शोइंग द रिलेशन ऑफ सेंट्रल पार्ट और बॉडी। वहाँ पे आप देख सकते हैं जो लैटरल वेंट्रिकल का सेंट्रल पार्ट है दैट इज रिलेटेड टू कोडेट न्यूक्लियस स्ट्राया टर्मिनालिस, और मीडियली किस स्ट्रक्चर से रिलेटेड है? सेप्टम पेल्यूसिडम, और सुपरफिशियली किस पार्ट से रिलेटेड है? तो कॉर्पस कैलोजम से रिलेटेड है। ठीक है, नाउ अभी हम बात करते हैं एंटीरियर हॉर्न की। तो अगर एंटीरियर हॉर्न आप देखें तो इट इज रिलेटेड सुपीरियरली टू विच स्ट्रक्चर? कॉर्पस कैलोजम, मीडियली टू सेप्टम पेल्यूसिडम। ओके, एंड इफ यू विल सी दिस इज द रोस्ट्रम ऑफ कॉर्पस कैलोजम विच इज रिलेटेड इन द फ्लोर। तो अगर फ्लोर ऑफ एंटीरियर हॉर्न की बात करें तो इट इज रिलेटेड विद द रोस्ट्रम ऑफ कॉर्पस कैलोजम, इट इज रिलेटेड विद द रोस्ट्रम ऑफ कॉर्पस कैलोजम। नाउ सी दिस, सो यहाँ पे क्या लिखा है? जेन्यू ऑफ कॉर्पस कैलोजम इज फॉर्मिंग द फ्लोर, एंड वी हैव जस्ट सीन एक्चुअली कॉर्पस कैलोजम के फ्लोर में जेन्यू नहीं होता है, रोस्ट्रम होता है। क्या होता है? जेन्यू नहीं होता है, रोस्ट्रम होता है। सो जेन्यू ऑफ कॉर्पस कैलोजम इज नॉट फॉर्मिंग द फ्लोर, बट द रोस्ट्रम पार्ट ऑफ कॉर्पस कैलोजम इज फॉर्मिंग द फ्लोर। हाउ यू आर अंडरस्टैंडिंग दैट? अगर हम बात करें कॉर्पस कैलोजम, व्हाट इज कॉर्पस कैलोजम? क्या होता है? कॉर्पस कैलोजम होता है कनेक्टिंग लिंक। कॉर्पस कैलोजम इज द वाइट फाइबर्स विच इज कनेक्टिंग द राइट एंड द लेफ्ट सेरेब्रल हेमिस्फीयर। एक्चुअली कॉर्पस कैलोजम के बिलो जो कैविटी होती है उसको हम लैटरल वेंट्रिकल कहते हैं। और अगर हम एंटीरियर पार्ट ऑफ लैटरल वेंट्रिकल के फ्लोर का रिलेशन की बात करें तो इट इज रिलेटेड टू रोस्ट्रम, नॉट टू जेन्यू। सी हियर, ये डायग्राम मैं दिखाती हूँ तब आपको समझ में आएगा। ये जो स्ट्रक्चर आप देख रहे हैं ये क्या है? कॉर्पस कैलोजम है। ठीक है, तो कॉर्पस कैलोजम का ये वाला जो पार्ट है ये आर रोस्ट्रम है, ये जी जेन्यू है, ये इसका बॉडी या ट्रंक है, और ये क्या है? स्प्लीनियम है, एस फॉर स्प्लीनियम। दीज आर द पार्ट्स ऑफ कॉर्पस कैलोजम। यस डॉक्टर सुदीप सिंह, यू आर राइट, इट इज वाइट मैटर। और ये जो वेंट्रिकल है, इसके नीचे जो वेंट्रिकल दिख रहा है, इसके नीचे जो ये वेंट्रिकल है, ये कौन सा वेंट्रिकल है? लेटरल वेंट्रिकल है। ये कौन सा वेंट्रिकल है? लेटरल वेंट्रिकल है। ठीक है, तो ये लेटरल वेंट्रिकल। तो अगर मैं लेटरल वेंट्रिकल के एंटीरियर एक्सटेंशन की बात करूँ तो ये क्या हो गया? फ्लोर। सो अगर आप देखो तो आर जो है वो लैटरल वेंट्रिकल के एंटीरियर एक्सटेंशन का फ्लोर बना रहा है, यानी कि रोस्ट्रम इज फॉर्मिंग द फ्लोर, यानी कि रोस्ट्रम इज फॉर्मिंग द फ्लोर ऑफ लैटरल वेंट्रिकल, रोस्ट्रम इज फॉर्मिंग द फ्लोर ऑफ लैटरल वेंट्रिकल, नॉट द जेन्यू। ऑल अदर ऑप्शंस आर एब्सोल्युटली करेक्ट. All other options, inferior horn is related to collateral sulcus, posterior horn is related to tapictum is absolutely correct. See here. Now अगर हम lateral horn के inferior lateral ventricle के inferior horn की बात करें, so absolutely you can see it is related with the collateral sulcus, collateral eminences and tapictum. Same way if you see the posterior horn, it is also related to tapictum. What is tapictum? What is tapictum? It is the part of white matter. Doctor, okay, you got it dear? Everyone समझ में आया? So let's move on to the next. ये all of the following statement is correct regarding the structures given in the image except. Please mark the right answer. Root value of the structure is, so arrow mark structure को पहले identify करना है इस diagram में. Firstly identify करिए इस diagram को, और उसमें ये जो एरो मार्क स्ट्रक्चर है वो क्या है वो आइडेंटिफाई कीजिए. फिर बताइए कि उसके लिए राइट ऑप्शन क्या है. रूट वैल्यू उसका L2, L3, L4 है. सप्लाइज मसल्स ऑफ एंटीरियर पार्ट ऑफ द थाई. सिफाइनस नर्व इज अ ब्रांच फ्रॉम एंटीरियर डिवीजन, गिव इनोवेशन टू पेक्टिनियस मसल. डॉक्टर लिट ने सी बोला है. आई एम वेटिंग फॉर अदर्स टू आंसर. येस डियर, लेट्स सी द अदर्स. sciatic nerve, ये sciatic nerve है, no it's not sciatic nerve. You see this is the cadaveric image. So ये जो cadaveric image है ये anterior aspect of thigh है. So can you tell me which area is this? Anyone? Mukesh, Brijesh, Ashwadhama, Dr. Sudeep Singh, Nidhi Ratan. Can you tell me which structure is this? Which area is this? Okay, I got yours. C is the right answer you are telling. Okay, I will come to that point, but you can tell me which area, which nerve is this and which area is this? Which nerve is this and which area is this? This is the area of femoral triangle. This absolutely right, doctor. So this is the area of femoral triangle. So this is the nerve, this is femoral nerve, this is femoral artery, and this is femoral vein. This is femoral vein. Now we got that the femoral nerve is there. So saphenous nerve is a branch from anterior division of femoral nerve is wrong. Actually saphenous nerve is the branch of saphenous nerve is the branch from which division? Posterior division. It is a branch from posterior division of femoral nerve. Posterior division of femoral nerve. Yes, all of you are right कि ये femoral nerve है, डॉक्टर सुदीप एंड एवरीवन. बट अगर आप ये डायग्राम देखें तो हम आउटलाइन कर रहे हैं femoral triangle को, विच का उसका बेस बना है inguinal ligament से, sartorius muscle है which is forming its laterally border and that of adductor longus is forming medial border. That is clear. Now अगर आप femoral nerve पहचान गए तो आपको क्या जानना है? femoral nerve की distribution के बारे में जानना है. तो you can clearly see that its root value is formed by L2, L3 and L4. No doubt about that. अभी हमें क्या जानना है? इसका anterior और posterior division. अगर आप देखो तो this is the anterior division. Anterior division is giving innervation to sartorius muscle and giving to cutaneous nerve. This is the parts of anterior division. अगर posterior division की बात करें तो posterior division is giving innervation to quadriceps femoris muscle, vastus medialis, vastus lateralis, rectus femoris, vastus intermedius, and giving one cutaneous nerve. The name of that cutaneous nerve is saphenous nerve. अगर cutaneous nerve की बात करें तो that is the saphenous nerve which is given from the posterior division and not the anterior division. Now identify the arrow mark structure in this image. Identify the arrow mark structure in this cadaveric image, that is the sagittal section of the brain. This image is of sagittal section of the brain. Identify this structure. So identify the structure, this arrow mark structure, whether it is third ventricle, interventricular foramen of Monro. So definitely interventricular foramen of Monro is the right answer. Yes, see here. So I have just taken another cadaveric images of the sagittal section of the brain where you can see the probe is inside. Can you see the probe is inside the foramen of Monro which is communicating with the lateral ventricle. So through a third to, so if you will see the communication between the third and the lateral ventricle, it is through foramen of Monro. It is through foramen of Monro and the arrow was exactly at the foramen of Monro. So yes, now let's question number 30th. All of the following structure pass through the marked opening as shown in the diagram. So you have to identify the arrow marked opening of the diaphragm and then tell me which of the following structure is not passing. Which of the following structure is not passing through foramen, through this this structure. Question number 30. Okay. Mukesh and Apurva Shri is absolutely right. Yes, Mukesh and Apurva Shri, Dr. Sudeep Singh is absolutely right. Superior epigastric vessel. Actually, this opening is esophageal opening of diaphragm. This is esophageal opening of diaphragm, and through the esophageal opening of diaphragm, anterior posterior vagal trunk passes and esophagus passes and the esophageal branch of left gastric artery also passes. Superior epigastric vessel doesn't passes. Actually, you can see here in this diagram, the important structures passing through the esophageal hiatus is vagal trunks, esophageal branch of left gastric artery and that of esophageal tributaries of left gastric vein. Okay, foramen of Morgagni, अगर superior epigastric vessels की बात करें तो superior epigastric vessel is passing through foramen of Morgagni, foramen of Morgagni. So definitely the right answer is D. All of the following is true regarding the mark structure in the image. So इस image में आपको पहले ये arrow mark structure को identify करना है, which structure is this, and then you have to tell which is the wrong option. All of the following a true statement regarding the image except, ये muscle कौन सा है आप identify करो और फिर wrong statement about this muscle, which is the wrong statement about this muscle. Which is this muscle? Anybody can identify कौन सा muscle है ये? Which muscle is this? Lateral pterygoid, absolutely correct, absolutely correct. And here Mukesh is giving the right answer, upper head originating from lateral part of the lateral. Yes, absolutely correct. Upper head is originating from lateral surface of lateral pterygoid is not correct. Actually, lateral pterygoid muscle ka upper head is not originating from the this part. Actually, it is the lower head which is originating from the lateral pterygoid plate. Actually, upper head originates from infratemporal surface and infratemporal crest of the greater wing. So, absolutely correct. Here Mukesh is absolutely correct about the muscle and its wrong statement. So, you can see in this diagram, if I am enlarging this diagram, अगर मैं enlarge करती हूँ तो आप clearly देख सकते हैं ये कौन सा muscle है, lateral pterygoid है, ये LP lateral pterygoid है, ये जो muscle आपको इसके नीचे दिख रहा है ये MP है medial pterygoid, ये जो दिख रहा है वो masseter है, ठीक है, ये masseteric muscle. सो लैटरल टेरिगॉइड के बारे में पूछा गया, ये बक्सिनेटर मसल है, ठीक है. तो क्वेश्चन किस मसल के बारे में पूछा गया है? लैटरल टेरिगॉइड, यानी हमें लैटरल टेरिगॉइड के बारे में बताना है. तो यहाँ पे आप देख सकते हो दिस इज द लैटरल टेरिगॉइड प्लेट, दिस इज द लेटरल टेरिगॉइड प्लेट एंड लेटरल टेरिगॉइड प्लेट से जो मसल अराइज होता है वो लैटरल टेरिगॉइड का लोअर हेड होता है. कौन सा हेड? आप इस डायग्राम में देख सकते हैं कि लोअर हेड ऑफ लैटरल टेरिगॉइड इज अराइजिंग फ्रॉम द लैटरल टेरिगॉइड प्लेट. अपर हेड ऑफ लैटरल टेरिगॉइड, इफ आई टॉक अबाउट अपर हेड ऑफ लैटरल टेरिगॉइड, इट इज अराइजिंग फ्रॉम इंफ्राटेम्पोरल सरफेस ऑफ ग्रेटर विंग ऑफ स्फेनॉइड and they are inserting into pterygoid fovea that merges with the fibrous capsule and of the TM joint. So that is absolutely correct. Got it? Question number 32. Question number 32. All of the following statements are true regarding the arrow mark structure. All of the following statements are true regarding arrow mark structure. Question number 32. Which is the wrong statement? Which is the wrong statement? Dr. Sudeep Singh is telling C. Acha, can you tell me all of the following statements true regarding arrow mark structure? So यहाँ पे अगर मैं बात करूँ तो ये जो स्ट्रक्चर है वो किसके बारे में बोला गया है? कौन सा वो जो एरो मार्क एरिया है वो कौन सा पार्ट है? Okay, can you tell me what is this arrow mark structure? ये एब्सोल्युटली करेक्ट, यहाँ पे मुझे आंसर्स मिले हैं और वो एब्सोल्युटली करेक्ट है. डॉक्टर सुदीप सिंह, yes, and Mukesh, absolutely correct. It encloses the sigmoid sinus is not the correct answer. और yes, C is absolutely right. Mukesh and Dr. Sudeep Singh, both of you are right. Now अगर मैं बात करूँ तो ये जो एरो मार्क स्ट्रक्चर है वो टेंटोरियम सेरिबेली है. दिस इज अ फोल्ड ऑफ ड्यूरा मैटर. ये क्या है, एक फोल्ड ऑफ ड्यूरा मैटर है और हमें जानना है ये कौन से स्ट्रक्चर्स को इनक्लोज कर रहा है. तो यू कैन सी दिस डायग्राम एंड यू कैन क्लियरली सी दिस वॉज द एरो मार्क स्ट्रक्चर which is the tentorium cerebelli. And what is tentorium cerebelli? It is a fold of dura mater which is separating the occipital lobe of cerebral hemisphere with that of cerebellum. It is forming a separation between the occipital lobe of cerebral hemisphere and that of cerebellum. So tentorium cerebelli is protecting the cerebellum below. So what you can see in this diagram, अगर आप ये diagram देखें और मैं enlarge करती हूँ तो ये जो structure आप देख रहे हैं this is what, this is the tentorium cerebelli. और इस diagram में आप देख सकते हैं कि ये दो sinuses को enclose कर रही है, दो dural sinuses को enclose कर रही है. The two dural venous sinuses which is enclosed by it, one is superior petrosal sinus and the other is transverse sinus. So which two sinuses are enclosed by the which two sinuses are enclosed by tentorium cerebelli, that is superior petrosal sinus and transverse sinus. So here you can write down tentorium cerebelli is enclosing superior petrosal sinus and that of transverse sinus. Now coming to the next, a 20-year-old male presents with the feature of nasal obstruction. So he is presenting with the feature of nasal obstruction and you have to tell me which is most likely producing the symptomatic nasal obstruction, whether it is external nasal opening, internal nasal opening, external nasal valve और internal nasal valve. तो इस क्वेश्चन को सही मार्क करने के लिए आपको ये बताना है कौन सा एरिया है जो नेजल ऑब्स्ट्रक्शन में सबसे ज़्यादा इन्वॉल्व होता है. दैट इज़ ए नैरो एरिया इन द नेजल कैविटी. सो आई गॉट एन आंसर फ्रॉम अपूर्वा. अपूर्वा श्री इज टेलिंग डी. व्हाट अबाउट अदर्स? डॉक्टर सुदीप सिंह इज ऑल्सो टेलिंग डी. Absolutely correct. Internal, Dr. Aswadhama is also telling D. Absolutely correct. Internal nasal valve is absolute. Nidhi Ratan is also telling D. Absolutely correct, dear. Yes, if I talk about internal nasal valve, it's the narrowest space and often involved in nasal obstruction. अगर मैं internal nasal valve की बात करूँ तो its angulation is approximately 10 to 15 degree and it is the narrowest. ये सबसे narrow structure है, cross sectional area है जहाँ पे सबसे ज़्यादा air flow का रेजिस्टेंस होता है और सिम्टोमैटिक नेजल ऑब्स्ट्रक्शन का रीज़न भी इंटरनल नेजल valve होता है. यस मुकेश, यू आर एब्सोल्युटली राइट. एवरीवन इज एब्सोल्युटली राइट. सो आई वुड लाइक टू शो यू दिस डायग्राम. यहाँ पे आप नेजल सेप्टम देख सकते हैं, अपर लैटरल कार्टिलेजेस देख सकते हैं एंड हियर यू कैन सी द upper lateral cartilages and nasal septum is forming in a very narrow area, that is of the area of internal nasal valve. Approximately this angulation is 10 to 15 degrees and this is the most common area to be involved in case of nasal obstructions. Okay, अगर anterior opening देखेंगे तो that is also wide. Posterior opening of the nasal cavity is wide and also external nasal valve is quite wide as compared to internal nasal valve. So the narrowest area will be the internal nasal valve. Let's move on to the next MCQ, that is MCQ number 34. A 28-year-old male presents with ptosis and meiosis of right eye. तो ptosis है, meiosis है. He further gives a history of anhidrosis. There is also a history of anhidrosis and flushing of the skin. So which is the most probable reason and the cause? This is involving, this is a case of absence of symptomatically stimulated function of right side of head. Absence of symptomatic. So actually give me the right answer here. तो यहाँ पे ptosis है, meiosis है right eye का, anhidrosis and flushing. So what is this condition? What is this condition? You can tell me the answer. What is this condition called as? Question number 34. Yes, you are right that absence of sympathetically stimulated function of right side of head is right. So what is that condition called as? Mukesh, Nidhi, Ratan, everyone is right. But can you tell me what is this condition? This is a condition of Horner syndrome. This is a condition of Horner syndrome where sympathetic fibers has been involved and it is causing, it is showing you the symptoms of Horner syndrome. So in Horner syndrome you can see there is partial ptosis, there is anhidrosis absence of sweating, there is meiosis, there is yes, absolutely right, Sani Sab. Now let's move on to the next question, number 35. A patient in his, yes, Dr. Ashwadhama, absolutely right. A patient in his 70s present to the emergency department with a one-day history of intermittent epigastric abdominal pain that radiates into his back. The patient reports that the pain has been increasing in severity over the past few hours. He vomited after the lunch, which led him to seek medical help. The patient has a history of hypertension that is being controlled with metoprolol. He has also been experienced fever, diarrhea, other symptoms of abdominal pain. His vitals are normal range with no fever. On physical examination, the patient abdomen is tender in epigastric area with guarding of the masses. Diffused treatment. This is a case of abdominal aortic aneurysm, sepsis, peptic ulcers. And you just tell me that abdominal aortic aneurysm is dilatation of the abdominal aorta. So the blockage of which part of the duodenum is seen here, and which part of the duodenum is vulnerable in this condition. So I got an answer from Apurva Shri, it's C. What about others? What about others? Yes, C is absolutely right answer. Actually, this is a case. What is this condition called as? This is a case of superior artery syndrome. Actually, superior mesenteric artery syndrome. Actually, the third part of duodenum. If I would like to show you a diagram, the third part of duodenum is sandwiched between the abdominal aorta and superior mesenteric artery. So it can be compressed by superior mesenteric artery, and that condition is called as superior mesenteric artery syndrome. See here. Here in this diagram, you can see this is the third part of duodenum, and third part of duodenum is exactly lying in between the superior mesenteric artery and that of this is superior mesenteric artery, and posteriorly is the aorta. So you can see here duodenum horizontal part, that is the third part, is compressed. So duodenum, this is superior mesenteric artery, posteriorly we have got the aorta. So exactly in this diagram you can see the compression of the third part of duodenum, that is the horizontal part. Third part of duodenum is between that of the aorta and superior mesenteric artery. Okay. Now coming to the next. Okay, so everyone, don't worry, I will complete the 50 MCQs and then I will give you a break, and then we will complete the other 50. Is it okay? Mukesh, Apurva, Ashish, Kotik, Kumar, Nidhi Ratan, Dr. Sudheep Singh, Nidhi, everyone. So don't worry, we will complete the 50 MCQs and then I will give you a break. So a 56-year-old man with a prolonged history of hypertension medical hypertension, this is a case of hypertension, medications is given, emergency department, abrupt onset and severe tearing back pain. Okay, so please note down, यहाँ पे जो pain है वो abrupt onset का है, hypertension है और severe है. Blood pressure rises to 240 to 130. And this is a case of descending aortic dissection originating from the left subclavian artery, take off, extending into the patient, admitted for the further investigations, blood pressure reduced, pulse also decreased, neurological examination shows normal cranial nerve and upper extremities, weakness is bilateral, lower extremities, decreased tendon reflexes, and the patient is unable to sense the crude touch and pain in the lower extremities, but vibration sense is intact. So which of the following is most likely the cause of the current scenario? So we have got actually Apurva is telling D with a question mark. Yes, this is actually what we can do. The other way to solve such kind of MCQs is that we can rule out. So here what happens, if we can just rule out the options and we can proceed for the right answer. So here if I take the option A, it is not right. The reason is that carotid artery occlusion presents with acute stroke and the patient. So when I am talking about carotid artery occlusion, it presents with acute stroke, and the patient's symptoms will be unilateral, not bilateral. So this is wrong. Okay, so that is wrong. If I talk about the other one, that is compressive lumbar myelopathy, it is also not right because it is a consequences of lumbar stenosis. So here lumbar stenosis can lead to lumbar myelopathy, and then the compression and lower back pain will be there, but it is not, but here you can see the condition, and the clinical condition which is described is abrupt onset and bilateral involvement is there. Global cerebral hypoperfusion, if we are talking about global cerebral hypoperfusion, it is also not the correct answer here, because such kind of history will always have the presentation of patient will have the confusion, the patient will have loss of vision. So such kind of history is not provided. So definitely the correct answer is thoracic spinal cord ischemia. This is a case of thoracic spinal cord ischemia. Actually, when we are talking about in this patient, already it has been mentioned that the patient is having the case of descending aortic dissection, and it is always a severe case. It's always a severe case which is involving the patient, and actually the patient will have the involvement in the, there will be other involvement, that is the bladder is involved, lower extremities are involved, and because the posterior spinal arteries and all which is giving blood supply to the spinal cord, we know that there is anterior and posterior spinal artery. So other way of solving this MCQ is rule out the incorrect option. अगर मैं carotid artery occlusion इसकी सही आंसर नहीं हो सकती, क्योंकि वो acute stroke का कंडीशन होता है, and that condition is usually unilateral. अगर मैं बात करूँ कंप्रेसिव लंबर माइलोपैथी का, तो वहाँ पे प्रोग्रेसिव इंजुरी होती है और प्रोग्रेसिवली लंबार पेन इंक्रीज करता है और रीजन लंबार स्टेनोसिस होता है. ग्लोबल सेरेब्रल हाइपोपर्फ्यूजन में कंफ्यूजन होता है, लॉस ऑफ विजन होता है. thoracic spinal cord ischemia is definitely the right answer. So same thing has been written here, and that is the reason we will go with thoracic abrupt onset, और हमारे पास severe chest pain descending aortic dissection है. So we will go with the correct answer as thoracic spinal cord ischemia. Now question number 37. The following image shows blood supply to which part of the gut? So you have to just identify in this case that which part of the GIT tract has been shown in this diagram. None of the above? No. Which is, whether it is duodenum, jejunum or ileum, which part is it? Any idea? Kush. Dr. Punit. So don't worry, actually yes, one or two to Dr. Punit, you are absolutely right. Dr. Putin, you are absolutely right. Don't worry, this such kind of question will not come in FMG entrance exam. One or two टफ क्वेश्चन डालने के लिए मैंने ऐसा क्वेश्चन डाल दिया था. सो ऐसा क्वेश्चन नहीं आएगा आपको, इतना कन्फ्यूजिंग क्वेश्चन आपको नहीं आएगा और इतना लेवल का क्वेश्चन नहीं आएगा. लेकिन एज 100 MCQs था तो 5 या 10 क्वेश्चन तो मुझे भी डालना था, थोड़ा डिफिकल्ट लेवल का. सो आई हैव इंक्लूडेड दैट क्लिनिकल क्वेश्चन. डोंट वरी, otherwise I think most of you have got a good preparation, so you will definitely crack the exam. My all good wishes are with you, so don't worry. So yes, let me check who is giving the right answer for 37. So this is a jejunum loop. Okay, so yes Mukesh, you are right. This is absolutely right dear. So yes, absolutely right, जेजुनम है. क्यों ये जेजुनम है? क्योंकि यहाँ पे आर्टीरियल आर्केड 1 और 2 है और वासा रेक्टा लॉन्ग है, वासा रेक्टा लॉन्ग और स्ट्रेट है. सो अगर आप देखो तो ये डायग्राम है जिसमें मैंने जेजुनम और इलियम दोनों लूप दिखाया है, और जेजुनम और इलियम के दोनों लूप में आप देख सकते हो कि आर्टीरियल आर्केड्स का लेस नंबर और लॉन्ग वासा रेक्टा जेजुनम में होता है, शॉर्ट वासा रेक्टा और ज़्यादा आर्टीरियल आर्केड इलियम में होता है. So same thing you can see, arterial arcades are more in ileum as compared to jejunum. So definitely we will have jejunum as the right answer. Question number 38. Duodenum, no, duodenum में तो blood supply is from anterior and posterior pancreatico-duodenal arteries, mainly from the pancreatico-duodenal artery which is not forming vasa recta or arterial arcades. So definitely duodenum का तो no chance है Vicky. The doubt is between the jejunum and ileum only. So we will go with jejunum as the right answer. Question number 38. It's an easy one only. A 14-year-old boy comes to emergency department. Her father told that during the football game he met an injury and he complained of severe pain on posterior abdominal wall of right side in the hypochondric and lumbar region. On examination, doctor found tenderness in the area below 12th rib. So you can tell me which is the structure being involved. यस एब्सोल्युटली राइट कौटिक कुमार, इट्स द राइट किडनी। एक्चुअली ये बहुत इजी इसलिए हो जाता है क्वेश्चन क्योंकि यहाँ पे मैंने ये मेंशन कर दिया है कि पोस्टीरियर एब्डोमिनल वॉल राइट साइड में इन्वॉल्व है। यहाँ पे मैंने ऑलरेडी ये मेंशन कर दिया है कि ये राइट साइड में इन्वॉल्व है। डॉक्टर लेट प्लीज सी, यहाँ पे है पेन ऑन द पोस्टीरियर एब्डोमिनल वॉल ऑन राइट साइड, तो लेफ्ट साइड तो आंसर हो ही नहीं सकता। और स्प्लीन, left kidney, pancreas is having an extension on the left side, so definitely the answer will be B, right? Yes dear, so only I told you ये question बहुत easy है। okay, so actually renal angle is the angulation between the 12th rib and erector spiny muscle। yes Sudeep, you are absolutely right। lesion of hypoglossal nerve will result in which one of the following? Which one of the following? Loss of taste sensation on the posterior 1/3 of the tongue, deviation of protruded tongue towards unaffected side, deviation of protruded tongue towards affected side, inability to retract the tongue. Yes Mukesh, that is right। Now please mark the right answer for question number 39। Lesion of hypoglossal nerve, yes, so I think the correct answer is coming from Kautik Kumar, Dr Putin and Apurva। See, yes, we know that hypoglossal nerve injury will cause ipsilateral deviation, and the reason is that जो हमारा ये जो hypoglossal nerve होता है, अगर हम बात करें hypoglossal nerve की, तो it is giving innervation to tongue muscle, और जो maximum amount of tongue muscle is made of which muscle? Genioglossus muscle। तो genioglossus muscle is the most bulky muscle, and we know that both side of genioglossus muscle will contract and lead to the protrusion of tongue, will lead to the protrusion of the tongue। so definitely protrusion of the tongue होता है, और अगर एक साइड का genioglossus paralyzed है तो it will lead to the ipsilateral deviation of the tongue। now which of the following is the paired laryngeal cartilages? so यहाँ पे जो cartilages है larynx का, which one is the paired one? This has been asked in the FMG examination before। which are the paired laryngeal cartilages? so I got an answer from Deva, Gujjar Deva, Vicky, Mukesh, can you tell me the right answer? I got a right answer from Dr Sudeep Singh, Urvashi, Ashish, Apurva Shri, Kotek, Nidhi Ratan, absolutely right। the right answer is arytenoid, corniculate and cuneiform, Dr Lit, yes। so actually यहाँ पे हम देखें तो thyroid, this is the thyroid cartilage, this is the cricoid cartilage, and this is the epiglottis। so these three are the unpaired cartilages, these three are unpaired cartilages। और अगर हम ये डायग्राम देखें तो corniculate, cuneiform and arytenoid, so corniculate, cuneiform, arytenoid, these are all paired cartilages of the larynx। now let's form the next question। question number 41। the police department found a mandible bone, the police department found a mandible bone and handed over to the mandible to the forensic team for further investigations, and the forensic team after the complete examination of the mandible told that the police department that this mandible belongs to adult person। what do you think helped him to reach to the conclusion? A, presence of mandibular foramen, presence of mental tubercle, mental foramen opens near the socket of lower border, mental foramen opens in the midway between the upper and the lower border। question number 41। so here you can see policeman has to hand it over to the mandible after having a complex adult person। see here the hint is given the adult, तो adult होने के लिए what is the location of the foramen? so D answer given by medical and health awareness Kotik is absolutely right। yes 41D is Putin, Dr Putin all is absolutely mental foramen opens midway between upper and lower border। see this diagram, when you will see this is the location of the mental foramen, as you can see here this is mandibular foramen and it is exactly passing through mandibular canal through which the branches of inferior alveolar nerve traverses। now here in this diagram you can see the location of the mental foramen according to the age changes। so in adult it is midway, In the old age, it is towards the upper border. In the childhood, it is towards the lower border. So midway is the right answer, between upper and lower. Yes, absolutely right. Question number 42. An athlete comes to the physician with inflammation of the lateral side of the right thigh. He presents with flexion, abduction, external rotation along with Ober's test positive. So that is the hint. Ober's test positive. And what is the probable diagnosis? Subluxation of tibia, flexion, lateral rotation of the knee, and Ober's test is positive. What is the possible diagnosis? Question number 42. 42 B, and Putin is telling B, Apurva Shri B, Kotik is telling A. Iliotibial band contracture. Actually, iliotibial band, there is a Ober's test which is done, which is the contracture of the iliotibial band, which is extending laterally in our thigh and ending at the level of Griddy's tubercle, lateral aspect of the tibia. So Ober's test is positive in iliotibial band contracture. So definitely you can see this is the iliotibial band contracture. Iliotibial band is a modification of the deep fascia of the thigh, which is ending at the level of the lateral aspect of the knee, and its contracture is giving us the attitude of the person is the person presents with hip flexion, abduction and external rotation, and definitely iliotibial band contracture is the right answer. Now let's move on to the next, that is question number 43. A person presents with appendicitis. So you have to just see this diagram and tell me what is the procedures which is being done. So here you can see uterus has been sewn, urinary bladder and rectum has been sewn. So that is the hint which is given to you. So clearly it will become very easy for you to identify the procedure, because the image is showing you exactly the procedure which is being performed. Question number 43. Purva Shri, Dr. Sudhip Singh, Urvashi, Putin, absolutely right, Kaldu-centesis. Okay, so fluid accumulated in recto-uterine pouch of Douglas. So fluid is accumulated in recto-uterine, yes, absolutely right, uterine pouch of Douglas, and from here pouch of Douglas, and the fluid will be cleared off by the process of Kaldu-centesis. Now here Kodo-centesis was given, that was wrong, because it is a procedure it is a procedure which is done to see any kind of abnormality in the unborn baby. And if we talk about paracentesis, it is also it's a procedure of seeing the peritoneal fluid and their abnormalities. Kaldu-centesis, yes, Mukesh, this is a procedure to take to see the abnormal fluid accumulated in recto-uterine. Yes, I think yes, Deva. Yes, Gujjar Deva, yours right. C is the right answer. Yes, absolutely right, dear. Kaldu-centesis is absolutely right, which check abnormal fluid accumulated in recto-uterine pouch of Douglas. And one more process was that cystocentesis. Actually, cystocentesis is the procedure which is performed in animals for taking out the fluid. This is not related to human beings. Question number 44. A developmental neurobiologist is surgically removing the neural crest cells and the thoracic region of chicken embryo immediately after the closure of neural tube. What type of the cell is most likely affected here? So the hint provided is neural crest cell. So you have to tell me the derivative, which of the following. बहुत easy हो जाता है ये question, क्योंकि अगर आपको neural crest वहाँ पे mentioned है, तो you have to tell me which of the following structure is the derivative of neural crest here. Which of the following structure here is the derivative of neural crest? I got an answer from Dr. Lit as B. What about others? What about others, dear? Kotik Kumar, yes, autonomic ganglia in the thoracic. So autonomic ganglia, dorsal root ganglia, parafollicular cells, C cells, and all these structures are absolutely the correct answer will be B. Autonomic ganglia is neural crest derivatives. So autonomic ganglia, dorsal root ganglia, all are the derivatives of neural crest. अगर हम बात करें कार्डियक मसल, अदर ऑप्शंस, अगर यहाँ पे ऑल अदर ऑप्शंस है बोन्स, एपिथेलियल लाइनिंग ऑफ लोअर रेस्पिरेटरी ट्रैक और कार्डियक मसल. सो आई जस्ट वांट टू रूल आउट कार्डियक मसल इज नॉट द राइट आंसर बिकॉज इट्स डेवलप फ्रॉम स्प्लैंक्टिक मेसोडर्म. Epithelium of lower respiratory tract is not the right answer because it develops from endodermal germ layer. Ribs are not the right answer because it develops from paraxial mesoderm. Now coming to the question number 45, which of the following is not supplying the marked area of the heart? So in this image, you have to firstly identify which is the marked area and then tell me which is the artery not giving blood supply to that area. Question number 45. Which of the following is not supplying the marked area of the heart? What is the marked area? Can you tell me which is the marked area here? Which is the marked area? I got a right answer from Putin. Putin, yes, diagonal artery is the right answer. Yes, Putin is absolutely right. Yes dear, you are absolutely, actually this is the marked area is right ventricle. ये कौन सा area है? ये राइट वेंट्रिकल का एरिया. ये कौन सा चेम्बर है? राइट वेंट्रिकल. और राइट वेंट्रिकल इज नॉट गेटिंग, नो इट्स राइट वेंट्रिकल डियर. लेफ्ट एट्रियम तो आपको पोस्टीरियरली दिखेगा. ये राइट एट्रियम है और ये लेफ्ट वेंट्रिकल है. और यहाँ पे जो एरो मार्क्ड है वो राइट वेंट्रिकल में है. और डायगोनल आर्टरी इज अ ब्रांच ऑफ, if I talk about diagonal artery, it is a branch of left coronary artery and it is not giving, it is, yes Mukesh, you are right, right ventricle, and diagonal artery is not giving blood supply to the right ventricular area. So you can see major blood supply is from left and the right coronary artery. Lad artery is the branch from anterior descending artery is a branch, and circumflex artery is a branch of left coronary artery, which is also overlapping and giving branch to right ventricle. But here you can see posterior interventricular artery or lad artery, that is the posterior descending artery, they are major blood distribution. What you can see the diagonal artery, if you will see the diagonal artery, you can clearly see diagonal artery is giving blood supply only to the left ventricle. It is giving blood supply only to the left ventricle, not to the right ventricle. So definitely D is the right answer. If this area is right ventricle and diagonal artery is a branch of left coronary artery which is giving blood supply only to the left ventricle. Which of the following is not supplied by the marked nerve in the given section? Actually, you can also mark this as a right answer by odd man out. Got it? Absolutely correct. Question number 46. एब्सोल्युटली राइट, यस सुपीरियर ऑब्लिक. सो एक्चुअली ये अगर आपको नहीं भी आता है तो भी आप राइट मार सकते हैं, क्योंकि इन्फीरियर ऑब्लिक, मीडियल रेक्टस, सुपीरियर रेक्टस का सेम नर्व सप्लाई होता है. यहाँ पे ऑड मैन आउट है सुपीरियर ऑब्लिक. अगर उस तरह से भी आप राइट आंसर मार्क कर सकते हैं कि सुपीरियर ऑब्लिक इज सप्लाइड बाय SO4 एंड ऑल दीज आर सप्लाइड बाय थर्ड क्रेनियल नर्व. सो यहाँ पे ऑड मैन आउट कौन सा है? जस्ट सुपीरियर ऑब्लिक है, तो सुपीरियर ऑब्लिक राइट आंसर है. यस मुकेश. सो यहाँ पे आपको ये जो नर्व को आइडेंटिफाई करना है, ये जो नर्व है वो थर्ड क्रेनियल नर्व है. सो सी दिस, यहाँ पे मैं मार्क करती हूँ, ये जो क्रेनियल नर्व है वो फर्स्ट क्रेनियल नर्व है. दिस इज द सेकेंड क्रेनियल नर्व, दिस इज द थर्ड क्रेनियल नर्व, दिस इज द फिफ्थ क्रेनियल नर्व. Okay, this is the fourth and that of the sixth cranial nerve. This is the 7th and 8th cranial nerve. This is the 9th, 10th and 11th cranial nerve, and this is the 12th cranial nerve. So यहाँ पे सारे cranial nerves मैंने identify कर दिए. और अगर third cranial nerve, arrow marked area किस area पे था? third cranial nerve पे था. This is which cranial nerve? third cranial nerve. And we know that the third cranial nerve is not giving innervation to superior oblique muscle. Superior oblique muscle is getting innervation from fourth cranial nerve. Now, all of the following are branches of marked structure in the image. So, you can tell me which is the red color structure which is marked by a blue arrow. What is that? That is the that is aorta. So, can you tell me which of the following artery is not a branch of abdominal aorta? Question number 47. Uterine artery, absolutely right, Putin and doctor. Yes, uterine artery is a branch of, yes Dr. Phoenix, you are also right. Uterine, Nidhi Ratan, absolutely right. Uterine artery is a branch of which artery? Can you tell me uterine artery is a branch of which artery? Uterine artery is a branch of which artery? Uterine artery is a branch of internal iliac artery. Internal iliac artery. Uterine artery is a branch of anterior division of internal iliac artery. Abdominal aorta branches has been shown here. It gives inferior phrenic. It gives a celiac trunk, superior mesenteric, inferior mesenteric, lumbar arteries. Its common iliac artery as the terminal branches. Now let's see the question number 41. Marked nerve innervate which of the following muscle? So you can see arrow is marked on which on the following nerve. So marked nerve, which is that nerve and what is the innervation of that nerve? Yes, internal iliac artery. Now tell me question number 48. So yes, corrugator superciliary is absolutely right answer. Actually this nerve is temporal branch of facial nerve. Yes, definitely cortic. So this is temporal, this is zygomatic, this is buccal, this are buccal, these are marginal mandibular, and this is cervical. So actually these are the terminal branches of facial nerve, and we can say that temporal branch. If I talk about the temporal branch, it is giving innervation to frontalis muscle and corrugator superciliary, and also the upper part of orbicularis oculi muscle. So here corrugator superciliary was marked. So definitely corrugator superciliary is getting innervation from temporal branch of the facial nerve. Yes dear Kotik ma'am, please explain arteries of ovary. Okay, arteries, you want to know the arteries? Yeah, अगर मैं बात करूँ ओवेरियन आर्टरी तो इसका मतलब होता है गोनाडल आर्टरी. ओके, गोनाडल आर्टरी. और ओवेरियन आर्टरी मतलब टेस्टिकुलर और ओवेरियन आर्टरी आर गोनाडल आर्टरी इन मेल एंड फीमेल्स लाइक. सो दिस गोनाडल आर्टरीज आर डायरेक्टली द ब्रांच ऑफ एब्डोमिनल आर्टरी, बट यूट्राइन आर्टरी इज अ ब्रांच ऑफ इंटरनल आइलियक आर्टरी. सो अगर आप ये डायग्राम देखेंगे तो आपको सारे इंपॉर्टेंट आर्टरीज के ब्रांचेस पता चल जाएंगे. सो यू कैन सी द ब्रांचेस ऑफ एब्डोमिनल ऑर्टा. तो एब्डोमिनल ऑर्टा के ब्रांचेस है इंफीरियर फ्रेनिक आर्टरी, सीलियाक ट्रंक, मिडल सुप्रारीनल आर्टरी, सुपीरियर मीजेंट्रिक आर्टरी, रीनल आर्टरीज एंड गोनाडल आर्टरीज. गोनाडल मतलब बोथ मेल्स में क्या होगा टेस्टिकुलर आर्टरी, फीमेल्स में क्या होगा ओवेरियन आर्टरी, लंबार आर्टरीज, 4 पेयर्स ऑफ लंबार आर्टरीज, inferior mesenteric artery, right and the left common iliac artery, and middle sacral artery. This is the terminal branches. So all these branches which is shown in this diagram are the branches of abdominal aorta. Ovarian artery or testicular artery is directly the branch of abdominal aorta. और अगर हम ये artery की बात करें uterine artery, so it is a branch of internal iliac artery. Uterine artery is a branch of internal iliac artery. So is it okay, Kotak Kumar? Ovarian arteries is a branch of abdominal aorta. Uterine artery, superior and inferior vesical artery, obturator artery, ये सारे जो arteries होते हैं, these are the branches of internal iliac artery. Is it okay, Kotak? Kotik Kumar, okay? Okay, thank you dear. Now let's move on to the next. All of the following is true statement about the green color marked muscle. So you have to identify the green color marked muscle and you have to tell me the right answer. All of the following are true about the structure marked in green in the image, except which muscle is this? You have to know which muscle is this and then you can give me the right answer. Okay, which muscle is this? Vicky, Apurva, Shri, yes, you all are giving the right answer. Can you tell me the name of the muscle? Dr. Sudeep, Kotik, no, oh, the right answer is D only, but which is the muscle? This is which muscle? Brachioradialis muscle. See here, this muscle is inserting onto the radial styloid process. It is inserting just above the radial styloid process and arising from supracondylar ridge, lateral supracondylar ridge of the humerus. So this muscle is BR, means brachioradialis, and the nerve supply of brachioradialis is directly from radial nerve, not from posterior introosseous nerve. Yes, brachioradialis right answer है और brachioradialis का innervation directly radial nerve से होता है, ना कि posterior introosseous nerve. So वो ही इसका wrong statement है. So we will have the right answer as the D. No, all. So yes. Deva, Gurjar Deva. So actually origin from lateral supracondylar is right statement, insertion proximal to styloid process is right, and causes elbow flexion is also right. So we have to go for incorrect. So posterior interosseous nerve is not the nerve supply, it's directly getting innervation from radial nerve. Now question number 50, what is the feature of highlighted muscle? Which muscle is this and what is the feature of that highlighted muscle? दिस इज विच मसल? पेक्टोरालिस मेजर मसल. और इसके फीचर क्रूशेट है, मल्टीपिनेट है, स्पाइरल है या यूनिपिनेट है? Spiral, absolutely right. Yes, this is spiral. So you can see here pectoralis major is spiral or convergent. Circular muscles are orbicularis oculioris. Fusiform are biceps. Parallel are rectus femoris. Bipinnate. So actually, if I talk about parallel muscles fibers, is the sartorius muscle. Bipinnate में introssei muscle, dorsal introssei and rectus femoris है. So these are multipinnate is deltoid muscle. So definitely in this diagram we can clearly appreciate the fibers are converging and in spiral in nature. Pectoralis major is the right answer is the spiral one. Multipinnate का example deltoid muscle है, deltoid muscle. Cruciate में masseter muscle आता है, sternocleidomastoid muscle आता है. Unipinnate में palmar introssei first and second lumbrical आता है, first and second lumbrical muscle आता है. Okay, so everyone, I will give you a break of 15 minutes. Is it okay? And then we will start with another. So we have done 50 MCQs. There are 50 more MCQs. So I think another 1.5 hours or something is needed for that. So what I will, we have already covered the first 50. 50 more is remaining. So I will give you a break of 15 minutes. Is it okay, everyone? Do you want me to continue or it's okay? You can take a break of 15 minutes and then we can start. Is it okay? So I just want you to give a break of 20 minutes. Okay, 20 minutes. Okay, 20 minutes break and then we will start. Okay? All the best. So I'm just, okay, dear. Okay. So let's start with the MCQs of 51 to 75. So we have finished the discussion of the 50 MCQ. 50 is still remaining. So let's finish it. So these are the easy ones, I think. These MCQs are easy one. The first 50 we have already done and the 50 more remaining. Yes, students. Ma'am, let's start. Okay, Kotik Kumar, great. Okay, sure, Kotik. So let's start with the question number 51. Superior border of the arrow mark structure is superior border of the arrow mark structure. So firstly, can you identify what is this arrow mark structure and you can tell me what is the superior border of it? Good evening, Dr. Sudhip Singh. Good evening, Kotik Kumar. Good evening, Doctor. So please let's start with the explanations of the MCQ. So I got an answer from Anish as C. What about others? ये जो एरो मार्क एरिया है वो कौन सा एरिया है आपको आइडेंटिफाई करना है. देन आपको बताना है कि इसकी सुपीरियरली बॉर्डर किस स्ट्रक्चर से बनती है. सो कोटिक इज ऑल्सो टेलिंग कोटिक कुमार इज ऑल्सो टेलिंग सी. व्हाट अबाउट अदर्स? पहले तो ये स्ट्रक्चर सुदीप सिंह इज ऑल्सो टेलिंग सी. आई गॉट अ राइट आंसर फ्रॉम पुटिन. Putin, you are absolutely right. It's the caudate lobe. Yes, actually this is foramen of Winslow. This arrow mark structure is foramen of Winslow. What is the other name of foramen of Winslow? It is called as epiploic foramen. Foramen of Winslow का दूसरा नाम क्या है? epiploic foramen. इसका दूसरा नाम है epiploic foramen. और ये जो epiploic foramen है ये communicate करता है greater और lesser sac में. Yes, सूरज प्रताप, you are absolutely right. Yes, why you remove that? It is the hepatoduodenal ligament. Absolutely right. ये hepatoduodenal ligament के पास होता है in the free margin of lesser omentum, और यहाँ पे आपका epiploic foramen होता है which is forming a communication between the greater and the lesser sac, और greater और lesser sac में ये communicate करता है. means posterior to that, okay, posterior to that we have got the epiploic foramen which is forming the communication. So superiorly it is bounded by caudate lobe of the liver, and inferior posteriorly it is bounded by, yes, so superiorly it is bounded by caudate lobe of the liver, and inferiorly it is bounded by the first part of duodenum, posteriorly by inferior vena cava, anteriorly by the free margin of the lesser omentum containing hepatic artery, bile duct and portal vein. Absolutely right, dear. Now all of the following forms the boundary of marked area in the image except. All of the following forms the boundary of marked area in the image except. All of the following forms the boundary of marked area in the image except. Question number 52. Dr. Sudeep Singh has given absolutely right answer. D is the right answer. Can you tell me what is this arrow marked area? What is this triangular blue color area? Can anybody tell me what is this blue triangular area? Which area is this blue triangular area? No. D is the right answer. Dr. Sudeep Singh has given the right answer. I just want to know what is this area. Then only you can make it the right answer. अगर आप ये area जानते हैं तो ही आप राइट आंसर दे सकते हैं. तो ये ट्रायंगुलर एरिया कौन सा एरिया है? व्हाट इज दिस? व्हाट इज दिस ट्रायंगुलर एरिया? दिस इज ट्रायंगल ऑफ कॉच. डॉक्टर सुदीप सिंह एब्सोल्युटली राइट. दिस इज अ ट्रायंगल ऑफ कॉच. Yes, and you can see the boundaries of triangle of Koch is, so this triangle, I am talking about this triangular area, and if you will see this, you can clearly mention that superiorly it is bounded by tendon of Todado, tricuspid valve is anteriorly, and posterior-inferiorly by the opening of coronary sinus. So definitely we can say that triangle of Koch is having these boundaries. And what is an important structures lying inside triangle of Koch? I would also like to show you a cadaveric image for this. So if you will see this cadaveric image, you can appreciate tendon of Todado is forming the superior boundary. Tendon of Todado is forming the superior boundary. The coronary sinus posterior-inferiorly, tricuspid valve leaflets is anteriorly, tendon of Todado is forming superior boundary. So here this is the tendon of Todado, this is the tricuspid valve, and this is the coronary sinus opening. So this is the triangle of Koch. Can you tell me what lies inside the triangle of Koch? Mukesh, Kotik, Sudeep Singh, Dr. Deva, Gujjar Deva, everyone. This question is for everyone. Put in. Can you tell me what lies inside the triangle of Koch? It's a very important structure. Is located inside triangle of Koch. The location of which structure is located here. This is located inside the right atrium, and in the interior of right atrium we have got triangle of Koch. What important structures is located inside? Anyone? An important structure located inside triangle of Koch is the AV node. What structure lies inside is the AV node. Yes. Now, which of the following structure? So, can you identify? Question number 53. Can you identify the structure marked here? What is the structure which is marked here? And you have to identify the arrow marked structure, and then you have to tell me which of the following structure crosses the arrow marked structure. Koch triangle is right. The AV node, yes Mukesh, AV node is the right answer. Now the next thing which I am asking you is the which of the following structure? Kotik Kumar, not heard this triangle. Okay, no worries. It is a triangle which is lying inside the right atrium. It is the triangle which is located in the right atrium, and this is a triangular area which is showing you the location of AV node. Now question number 53. Which of the following structure crosses the arrow mark structure in the given image? Yeah, this is the mesentery, and the structure which is, yes, you are absolutely right. This is the mesentery. Yeah, root of mesentery. So what would be the right answer? Which of the following structure is crossed by the arrow mark structure? कौन सा structure crossed होता है root of mesentery से? Root of mesentery is crossing which structure? So everyone is giving A. Let me tell you the right answer. Cortic, Deva, inferior mesenteric artery. No, that is not right. Apurva Shri, Dr. Sudeep Singh, everyone is giving the same answer. No dear, that is not right. If you have to know the structures crossed by the root of mesentery, and the structure crossed by the root of mesentery is horizontal part of duodenum. So here the right answer is B. The right answer is B, dear. Right answer is B, horizontal part of duodenum. Horizontal part of duodenum. See here, this is the mesentery. Yeah, so I was making the key for your MCQs, no, I was making the key for your test, so only that dot was marked there, because the key was made. I had made the key for that answers, no, so I have removed all that dots. Okay, so yes, the right answer is, now B is the right answer. Yes, Mukesh has given the right answer. The structure crossed by the root of mesentery is following. So this is very important for MCQ, that the structure crossed by the root of mesentery, and the structure crossed by root of mesentery is horizontal part of duodenum, abdominal aorta, inferior vena cava, right gonadal vessel, right ureter and right psoas major. तो ये सारे जो structures यहाँ पे mentioned है, these all structures should be known to you, and you should know these are the structures which will be crossed by. No dear, you can see horizontal part of duodenum. Can you see here? Kotak Kumar, just see this answer, just see this. So this is root of mesentery. Can you see here? What do you mean by root of mesentery? का मतलब क्या होता है? रूट ऑफ मीजेंट्री का मतलब होता है अटैच्ड बॉर्डर ऑफ द मीजेंट्री, अटैच्ड बॉर्डर ऑफ द मीजेंट्री. ठीक है, तो अगर आप ये जो अटैच्ड बॉर्डर ऑफ मीजेंट्री, कोटेक कुमार एंड एवरीवन जस्ट सी दिस डायग्राम, अगर मैं रूट ऑफ मीजेंट्री बोल रही हूं तो दैट मीन्स द अटैच्ड बॉर्डर. अटैच्ड बॉर्डर इज एक्सटेंडिंग फ्रॉम डिओडिनो-जेजुनल जंक्शन टू इलियोसिकल जंक्शन. नाउ कैन यू सी इट इज, if you will see this diagram, you can clearly see this is the horizontal part of duodenum, that is the horizontal part of duodenum is the third part. So in this diagram you can see root of mesentery. In this diagram you can see the root of mesentery is arising. So in this diagram you can see the root of mesentery is crossing the structures abdominal aorta, inferior vena cava, the right gonadal vessel, the right psoas major, and also the horizontal part of duodenum. Is it okay? Is it okay, dear? So have you understood now? It's Kotek Kumar. Is it okay? Have you appreciated that root of mesentery is crossing duodenojejunal junction, so it will cross the third part of duodenum. Is it okay? Okay, yeah. Okay, it's okay. Now coming to question number 54. All of the following structures are supplied by the marked structure in the image except. So you can see a small black color arrow is there. Got it? Digital, yeah, very good. So all of the following muscles are supplied by the structure marked in the image except. So you have to identify what is this loop. Can you see this yellow color loop? जहाँ पे मैंने arrow mark किया है, वो yellow color loop में arrow mark किया है, तो आपको बताना है कौन सा structure है जो कि innervate नहीं होता है ये yellow color loop से, जो कि innervate नहीं होता है ये yellow color loop से. So पहला है कि आपको जानना है ये nerve loop क्या है, or you have to tell me which of the following structure is not getting innervation from this nerve loop. Actually this nerve loop is ansa cervicalis. क्या नाम है इसका? इसका नाम है ansa cervicalis, and the correct answer is C, thyroid. The correct answer is C, thyroid. So don't worry, let me show you this image. Okay, let me explain it. Now ये जो मैं diagram आपको दिखाना चाह रही हूँ, this is the cadaveric image. So yes, I think I am getting a right answer C with everyone. Ansa cervicalis. Yes, let me explain this. Yes, Deva and Dr. Sudeep Singh, ansa cervicalis, Suraj Pratap, yeah, absolutely, thyroid, absolutely right answer. Let me show now what is the location of ansa. So all of you please concentrate on this cadaveric image. मैं चाहती हूँ कि आप ये cadaveric image को अच्छे से समझें, जिससे कि आप जान सकते हैं कि कौन से structures हैं जो इससे innervate होते हैं. So here first thing I want you to show, यहाँ पे ये जो outline है CC, it is the carotid artery. So this is the carotid artery, got it? Yeah, this is the carotid artery. Okay, now वी हैव गॉट हियर द वेगस नर्व. यहाँ पे आपको वेगस नर्व दिख रहा है. दिस इज द वेगस नर्व. Okay, then you can also see the internal jugular vein here. This is the internal jugular vein. Okay, got it. Now what you can appreciate in this diagram, that there is a nerve loop which is crossing this. Can you see a nerve loop is crossing this? सो ये जो नर्व लूप इसको क्रॉस कर रहा है, उसका ये सुपीरियर रूट है, ये इन्फीरियर रूट है. तो ये जो नर्व लूप है इसका नाम है अंसा सर्विकैलिस. व्हाट इज द लोकेशन ऑफ अंसा सर्विकैलिस? अंसा सर्विकैलिस इज लोकेटेड. Ansa cervicalis is a nerve loop which is formed by C2 and C3 and C1 fibers. Actually C1 fibers are crossing along with hypoglossal nerve, और ये जो nerve loop है वो anterior wall of carotid sheath में located होता है. Anterior wall of carotid sheath में located होता है, और हमें जानना है कि ये nerve loop किस मसल्स को सप्लाई करता है. तो आंसर है ये जो nerve loop है, it is giving innervation to infrahyoid muscle except the thyroid muscle. So let me show that. So you can clearly see this is the ansa cervicalis loop and this is the hypoglossal nerve जो C1 fibers के साथ क्रॉस हो रहा है, और C1 fibers के साथ hypoglossal nerve क्रॉस हो रहा है. It is giving innervation to thyroid muscle. So this is the odd man out. This thyroid muscle is one of the infrahyoid muscle which is not exactly getting innervation from the nerve loop. अगर मैं nerve loop की बात करूँ तो it is formed by C2 and C3. C1 is running along here with hypoglossal, so it is forming the upper root and this is the lower root. तो अगर मैं सिर्फ loop की बात करूँ तो loop is giving innervation to the loop. अगर मैं सिर्फ loop की बात करूँ तो loop is giving innervation to omohyoid, sternohyoid and the sternothyroid muscle, but it is not giving innervation to that of thyroid muscle. Yes, great. Now let's come up to question number 55. Mark ligament is attached to all of the following structure except. यानी आपको ये question mark ligament को identify करना है and then you have to tell which of the following structure is not getting attachment with this ligament. Mark ligament is attached to all of the following except. तो अब सबसे पहले आपको ये ligament identify करना है, which ligament is this, and then you have to tell me which of the following structure is not getting attachment from this ligament. Question number 55. Apurva is telling, doctor Lit is telling A with a question mark. Apurva is telling she with a question mark. And Ankit is telling B with a question mark. Nidhi Ratan is telling D with a question mark. What is this? Everyone is giving A, B, C, D. तो एक तो आंसर होगा ही dear. So Deva is telling A and Deva is telling A. Dr. Lit is telling A is the correct answer. Which ligament is this? Which ligament is this? This ligament is medial ankle ligament. This is medial ankle ligament and the other name of medial ankle ligament is deltoid ligament. तो ये कौन सा ligament है? Deltoid ligament है and it is not attached to the medial cuneiform. Let me show you a diagram for it. It becomes very easy for you to understand. तो अगर मैं ये enlarge करती हूँ तो आपको जो diagram में दिख रहा है वो medial ankle ligament और deltoid ligament है. Now here what happens? This medial ankle ligament, अगर आप ये bone देखते तो this is the lower end of tibia. Okay, so this is the lower, no worry Putin, I will explain it, no worries. So this is the lower end of the tibia which is called as that is medial malleolus. तो lower end of medial malleolus से एक attachment होती है medial ankle ligament की which is giving attachment to following structures. So what you can see here, from the medial malleolus we have got the attachment of this ligament towards the talus posteriorly and towards the talus anteriorly. तो ये दोनों ligament का नाम क्या होगा? This is called as posterior tibiotalar. इस ligament का नाम है posterior tibiotalar जो posteriorly medial malleolus और tibia को connect कर रही है. ओके और अगर मैं बात करूं एंटीरियर का तो इसका नाम है एंटीरियर टिबियोटालर. बहुत इजी है, डोंट वरी पुटिन एंड एवरीवन. एक्चुअली जब मैं बात करूं मीडियल एंकल लिगामेंट, सो इट इज गिविंग द सपोर्ट, इट इज गिविंग सपोर्ट टू द टू द एंकल जॉइंट मीडियली। तो ये लोअर एंड ऑफ टीबिया दैट इज मीडियल मैलोलस अटैच होता है टैलस में एंटीरियरली और पोस्टीरियरली। तो एंटीरियरली इस पार्ट के लिगामेंट को बोलते हैं एंटीरियर टिबियोटैलर, पोस्टीरियरली इसको बोलेंगे पोस्टीरियर टिबियोटैलर। तो ये करेक्ट हो गया कि ये टैलस से अटैच है। दूसरा पॉइंट क्या है कि ये लोअर एंड ऑफ टिबिया से यानी मीडियल मैलोलस से ये नेविकुलर बोन के तरफ जा रहा है। ये कहाँ जा रहा है? नेविकुलर बोन के तरफ जा रहा है, तो इसका नाम हो गया टिबियो नेविकुलर, ठीक है। और ये ट्यूबरोसिटी ऑफ नेविकुलर से अटैच हो रहा है और लोअर डाउन इट इज अटैच टू प्लांटर कैल्केनियो नेविकुलर लिगामेंट। व्हाट इज द अदर नेम ऑफ प्लांटर कैल्केनियो नेविकुलर लिगामेंट? स्प्रिंग लिगामेंट, ठीक है। उसी तरह हमारे पास एक और एक्सटेंशन है दैट इज फ्रॉम द मीडियल मैलोलस लोअर डाउन टू दैट ऑफ sustenta calcaneum of the callus bone. It is attached to the sustenta calcaneum of the talus bone of the calcaneum bone, sustentaculum tali of the calcaneum bone. So this part of the ligament which you are seeing is the tibiocalcaneum. यानी कि ये जो ligament है medial ankle ligament, it is attaching to the following bone. It is attaching to the talus anteriorly, posteriorly. It is attaching to the sustentaculum tali of calcaneum bone lower down. It is attaching to the navicular bone and to the plantar calcaneonavicular ligament. यानी कि ये सारे ये bones और ligaments से attach होता है लेकिन cuneiform bone से नहीं attach होता है। तो correct answer क्या होगा? medial cuneiform। सबको समझ में आया? Everyone, have you understood this? Dr. Putin, निधि रतन, देवा, अंकित पांडे, कोटिक, डॉक्टर टिल्ट, अपूर्वा श्री। ओके, हैव यू अंडरस्टूड दिस? कैन वी मूव ऑन टू द नेक्स्ट एमसीक्यू? क्वेश्चन नंबर 56। तो स्लाइटली मैंने जो एमसीक्यूज आपके लिए बनाया है फॉर योर एग्जाम, अगर आप इसमें 60% भी क्वेश्चन जानते हैं तो दैट इज़ गुड, दैट इज़ ए गुड, बिकॉज लेवल मैंने थोड़ा इंक्रीज रखा था। ओके, लेवल थोड़ा ज़्यादा था, ज़्यादा क्लिनिकल और ज़्यादा कैडेवरिक इमेजेस क्वेश्चन से। तो डोंट वरी, आप डिसहार्टन नहीं होना। बहुत इजी नहीं देना चाहती थी क्योंकि मैं सोची कि अगर ये एमसीक्यूज को हम साथ में मिलकर सॉल्व करेंगे तो इट विल बी यूजफुल फॉर यू। ओके, सो डोंट गेट डिसहार्टन। सो विच ऑफ द फॉलोइंग स्ट्रक्चर इज अ गाइड फॉर द नर्व इन? सो आपको ये मसल को आइडेंटिफाई करना है। विच मसल इज दिस? ये मसल को आइडेंटिफाई करना है यहाँ पे, और ये मसल के आइडेंटिफिकेशन के लिए मैं ये हाईलाइट कर रही हूँ मसल, और आपको उसकी नर्व सप्लाई बतानी है। मीन्स दिस इज रिलेटेड टू विच नर्व? सो दैट इज ओनली द करेक्ट आंसर फॉर क्वेश्चन नंबर 56। मार्क स्ट्रक्चर इज अ गाइड टू विच ऑफ द फॉलोइंग नर्व एट द लेवल ऑफ द रिस्ट? So please mark the right answer. Digital, निधि, everyone, क्या होगा ये आंसर? पहले तो मसल को आइडेंटिफाई करना है, फिर उसकी नर्व सप्लाई बतानी है। इजी है, इजी है। मीडियन नर्व, ऑफ कोर्स मुकेश, मीडियन नर्व इज द राइट आंसर। Yeah, median nerve. And which muscle is this? Which muscle is this? Yes, I am getting an answer. Which muscle is this? This muscle is palmaris. This muscle is palmaris longus muscle, and this is merging with, so here you can see this palmaris longus muscle. If you will see the palmaris longus muscle, this is having the nerve supply by median nerve. So median nerve block is done in relation with the palmaris longus muscle tendon. This palmaris longus muscle is merging with palmar aponeurosis, and what is the nerve supply of this muscle? That is the median nerve. It forms a guide for the median nerve. Yes, so you can see in this diagram also, अगर मैं ये डायग्राम दिखाऊं आपको, तो ये जो है वो palmaris longus muscle tendon है। Yes, yes, you are right, VD, Rax VD is right. इस palmaris aponeurosis से merge होता है, उसके नीचे कौन सा nerve है? median nerve है। Absolutely right. So what is the nerve supply of marked structure in the image? कौन सा muscle है ये? आइडेंटिफाई करना है और उसके बाद बताना है इसकी nerve supply क्या है। So what is the nerve supply of marked structure in this image? Yes, you are right here. $57 का आंसर डी, एब्सोल्युटली राइट, एब्सोल्युटली राइट। ये तो राइट आंसर है डॉक्टर पुटिन, लेकिन ये मसल कौन सा है? मेरा क्वेश्चन है ये मसल कौन सा है? क्या आपने ये मसल्स पहचाना? व्हिच मसल इज दिस? बहुत बार एमसीक्यूज राइट होता है लेकिन करेक्ट एक्सप्लेनेशन भी चाहिए, तो यस, ये मसल कौन सा है? व्हाट इज दिस मसल? देखो हिंट क्या है, ये अल्ना से अराइज हो रहा है, ये क्रेस्ट है और ये रेडियस बोन में जाके इंसर्ट होता है। कौन सा मसल है ये? विच मसल इज दिस? What is the nerve supply of marked muscle here? So सबसे इंपॉर्टेंट है, पहले आप बताओ मुझे ये कौन सा मसल है, फिर उसका नर्व सप्लाई। यस, ये डी आंसर राइट है कि इसका नर्व सप्लाई होता है पोस्टीरियर इंट्रोसियस नर्व से, लेकिन ये कौन सा मसल है? सुपाइनेटर मसल डियर, इट इज सुपाइनेटर मसल। सी हियर, this is a supinator muscle which is arising from the supinator crest. It arises from the supinator crest of ulna bone, और supinator crest of ulna bone से जाके रेडियस में इंसर्ट करने वाले मसल का क्या नाम है? supinator muscle। नहीं, it is supinator muscle because it is, see here, I have shown this to you, this is arising from the supinator crest of ulna and inserting into the radius bone, so definitely this is the supinator muscle and the nerve supply is by posterior introosseous nerve. Now, marked structure receive blood from all of the following except, marked structure receive blood from all of the following except, ये रेड कलर का एरिया जो आपको दिख रहा है, what is this? आपको आइडेंटिफाई करना है, फिर बताना है कि मार्क्ड स्ट्रक्चर रिसीव ब्लड फ्रॉम ऑल ऑफ द फॉलोइंग एक्सेप्ट, मार्क्ड एरिया रिसीव ब्लड फ्रॉम ऑल ऑफ द फॉलोइंग एक्सेप्ट। मार्क्ड स्ट्रक्चर रिसीव ब्लड फ्रॉम ऑल ऑफ द फॉलोइंग एक्सेप्ट सुपीरियर इंफीरियर पेट्रोजल साइनस, सुपीरियर ऑप्थैल्मिक वेन, स्फिनोपैराइटल साइनस, सुपरफिशियल मिडिल सेरेब्रल वेन। यस, सुपाइनेटर वॉज द प्रीवियस वन। नाउ यहाँ पे जो मुझे आंसर्स मिल रहे हैं 58 का पुटिन इज टेलिंग ए इज एब्सोल्युटली राइट आंसर। यस, पुटिन इज एब्सोल्युटली राइट। एक्चुअली ये जो एरिया दिखाया गया है आपको, ये कैवर्नस साइनस है, और अगर ये पूछ रहा है, ये क्वेश्चन में पूछा जा रहा है कि इट इज रिसीविंग ब्लड फ्रॉम ऑल ऑफ द फॉलोइंग सोर्सेज एक्सेप्ट, मीन्स कि हमें, अच्छा तुक्का है, ओके नो वरीज, आई विल टेल यू हाउ इट इज द राइट आंसर, आई विल टेल यू। इसमें आपको जानना है कैवर्नस साइनस। कैवर्नस साइनस इज अ वेरी इंपॉर्टेंट टॉपिक फॉर एफएमजी एग्जाम ऑल्सो, एंड आई वांट एवरीबडी टू नो दैट कि कैवर्नस साइनस की ट्रिब्यूटरीज आपको जाननी है। तो यहाँ पे अगर लाइक स्फिनोपैराइटल साइनस, मिडिल सुपरफिशियल मिडिल सेरेब्रल वेन एंड सुपीरियर ऑप्थैल्मिक वेन, ये जो तीनों वेन है ये डायरेक्ट ट्रिब्यूटरी है कैवर्नस साइनस की। तो superior inferior petrosal sinus communicating है, these are communicating channel, that is not the direct tributary, that is a communicating channel, so that is the right answer। ये डायग्राम में आप क्लियरली देख सकते हो कि डायरेक्ट, अगर मैं डायरेक्टली बात करूँ कैवर्नस साइनस की ट्रिब्यूटरीज को, इट इज हैविंग द ट्रिब्यूटरीज टेकन फ्रॉम द 3 सोर्सेज। ऑर्बिट से इसके 3 सोर्सेज आते हैं, सुपीरियर ऑप्थैल्मिक वेन, इंफीरियर ऑप्थैल्मिक वेन एंड सेंट्रल वेन ऑफ द रेटिना। मेनेंजियस से 2 सोर्स से इसको ब्लड रिसीव होता है, दैट इज स्फिनोपैराइटल साइनस एंड मिडिल मेनेंजियल वेन, और ब्रेन से रिसीव होता है सुपरफिशियल मिडिल सेरेब्रल वेन एंड इंफीरियर सेरेब्रल वेन। सो दैट इज एग्जैक्टली, यस पुटिन। जब मैं यहाँ पे क्वेश्चन क्या है कि आपको डायरेक्टली ड्रेन करता है, यहाँ पे क्या क्वेश्चन है, रिसीव ब्लड फ्रॉम ऑल एक्सेप्ट, रिसीव ब्लड फ्रॉम ऑल एक्सेप्ट का मतलब है जो वेन्स इसमें डायरेक्टली ड्रेन करते हैं, डायरेक्टली ब्लड सोर्स किससे आएगी वेन में, उसके डायरेक्ट ट्रिब्यूटरी से। सो सुपीरियर ऑप्थैल्मिक वेन, इंफीरियर ऑप्थैल्मिक वेन, सेंट्रल वेन ऑफ द रेटिना आर द डायरेक्ट ट्रिब्यूटरीज फ्रॉम द रीचिंग टू कैवर्नस साइनस फ्रॉम द सोर्स ऑफ ऑर्बिट। अगर मैं बात करूं मेनेंजियस से तो स्फिनोपैराइटल साइनस और मिडिल मेनेंजियल वेन है। ब्रेन की बात करूं, बात करूं तो इट इज फ्रॉम सुपरफिशियल मिडिल सेरेब्रल वेन एंड इंफीरियर सेरेब्रल वेन। नाउ सो दैट इज द थिंग। और अगर मैं कम्युनिकेशन की बात करूं तो ड्रेनिंग चैनल्स, कैन यू सी दिस डायग्राम, अगर मैं उसकी बात करूं तो ड्रेनिंग चैनल्स आर सुपीरियर इंफीरियर पेट्रोजल साइनस। सो यहाँ पे ड्रेनिंग, सुपीरियर इंफीरियर पेट्रोजल साइनस आर ड्रेनिंग चैनल, सो इट इज नॉट रिसीविंग डायरेक्ट ब्लड फ्रॉम द सोर्स। कम्युनिकेशन होता है, एज यू कैन सी कैवर्नस साइनस का इन्फेक्शन होता है वाया कम्युनिकेशन। Okay, so what happens, you will see the facial vein communicating with deep facial vein, pterygoid venous plexus, emissary vein and reaching the infection in the cavernous sinus। एक important source है infection का reaching to the cavernous sinus, वो है via facial vein, deep facial vein and then via communication with the pterygoid venous plexus and cavernous sinus. Now let's talk about this. All of the following structure passes through the fissure marked in this MCQ and mark the correct answer. So you have to understand. So you can see this is superior orbital fissure. Which fissure is this? Please tell me which fissure is this, and then you can tell me. Okay. Okay, all of the following structure passes through question marked fissure in the image except. Okay, can you tell me the name of the fissure? Can you tell me the name of the fissure? ये fissure का क्या नाम है? What is this fissure? Maxillary nerve is the right answer. Can you tell? Yes, medical and health awareness has given the right answer. This is superior orbital fissure. This is superior orbital fissure. Absolutely right. And we know that maxillary nerve passes through which fissure? My next question is maxillary nerve passes through which fissure? Yes, you are right. Dr. Litt has given a very correct explanation, and so nice of Dr. Litt. He is telling a very correct answer that ophthalmic branch, that is LFT, that is lacrimal frontal, these are the branches of ophthalmic division which passes through superior orbital fissure. And if I talk about maxillary nerve, can you tell me maxillary nerve passes through which fissure? It passes through which fissure? So the right answer is D, maxillary nerve, and it passes through which fissure? Foramen rotundum is absolutely right, dear. So superior orbital fissure se LFT jata hai, and that is here lacrimal frontal is branch of ophthalmic division and superior ophthalmic vein. Also the third nerves, the third nasociliary nerves and all passes through it. Okay. Now which of the following is the action of the muscle shown in the image? So ये जो muscle है, ये आप बताओ कौन सा मसल है और इसका एक्शन बताइए. इट्स ए इजी वन, आई थिंक इट इज इजी वन. सो यू जस्ट आइडेंटिफाई दिस मसल एंड टेल मी द एक्शन ऑफ दिस मसल. What is the action of the muscle shown in the image? What is the action of the muscle shown in the image? I got, so which muscle is this? Which muscle is this? Which muscle is this? Yes, I am getting a mixed bundle of answer. Which muscle is this? So actually the correct answer, which muscle is this? Can anybody tell me which muscle is this? Yes, the correct answer is A, knee extension and hip flexion. Which muscle is this? This is rectus femoris muscle, and rectus femoris muscle is one of the component of quadriceps femoris muscle, and it is causing knee extension and hip flexion. Yes. So this is origin of rectus femoris muscle. Now can you tell me, so this is showing you origin and insertion of rectus femoris muscle. Now next question is, injury to which of the following muscle lead to urinary incontinence along with cystocele, rectocele and prolapse of uterus? Yes, prolapse. Question number 61. Injury to which of the following will lead to? Okay, तो आपको ये बताना है कि which is the muscle which is the part of pelvic diaphragm. That is the question which you have to tell. Pelvic diaphragm. So here the right answer is given by medical and cortic. The right answer is pubococcygeus. Pubococcygeus is the part of pelvic diaphragm muscle, that is the part of levator ani muscle. So actually you can see here, actually जब मैं levator ani muscle की बात करती हूँ तो levator ani muscle is the muscle which is a part of pelvic diaphragm, and here you can see it is made of following parts. It's having a puborectal part, pubococcygeus part, iliococcygeus part, and posteriorly there is a coccygeus muscle. So yes, if we talk about levator ani muscle, it is giving support to the pelvic structures, and if it is injured it can lead to rectocele, prolapse of the uterus, and one of its component is pubococcygeus. So pubococcygeus is the part of levator ani muscle giving support to the pelvic structures. ठीक है. लिवेटर एनाई मसल का पार्ट होता है प्यूबोकॉक्सिजस विच इज वेरी इंपॉर्टेंट फॉर द पेल्विक सपोर्ट स्ट्रक्चर्स. Serous gemellins are present in large number in which of the following? This is a question of histology. Serous gemellin is present in large number in which of the following? Serous gemellin is present in large number in which of the following gland? Parotid, submandibular, sublingual and pituitary gland. A with a question mark. Putin has given the right answer. Submandibular gland is the right answer. Actually serous gemellins का दूसरा नाम है hidden hand, gemellin of hidden hand, और Gyanuzi इसका दूसरा नाम है Gyanuzi. Actually its maximum number is found in submandibular. Serous gemellin is also present in sublingual and submandibular both, but maximum number, अगर maximum number की बात करें तो maximum number of serous gemellins. ना डॉक्टर लेट मोर सलाइवा मतलब पैरोटिड है. सीरस जेमलिन्स का मतलब होता है बोथ, जो सीरस है वो बैठा हुआ है म्यूकस के ऊपर. ओके, दो तरह का एसएनआई होता है, एक सीरस होता है और म्यूकस होता है. सीरस जेमलिन का मतलब होता है सीरस इज ओवर द म्यूकस एसएनआई. सो इसका शेप कुछ ऐसा होता है. सी हियर, ये जो आप देख रहे हैं ये है म्यूकस और ये सीरस. तो सीरस और म्यूकस जब भी साथ होता है तो उसको हम क्या बोलते हैं? सीरस जेमलिन बोलते हैं. लाइक दिस, कैन यू सी हियर? तो ये जो है सीरस और म्यूकस का मतलब होता है, जैसे कि अगर हम बात करें पैरोटिड ग्लैंड की तो उसमें सिर्फ सीरस एसएनआई होती है. दूसरा एसएनआई जो म्यूकस सेक्रीशन करता है उसको हम बोलते हैं म्यूकस एसएनआई. तो जब सीरस इज एक्टिंग एज ए कैप ओवर द म्यूकस एसएनआई उसको सीरस जेमलिन बोलते हैं. सीरस जेमलिन्स का काम होता है लाइजोजाइम का सेक्रीट करना एंड इट इज एंटीबैक्टीरियल इन नेचर एंड मैक्सिमम नंबर ऑफ सीरस जेमलिन इज प्रेजेंट इन submandibular gland. So see here, mixed seromucous unit serous gemellin is present maximum in the submandibular gland. Now hypoglossal nerve, ये तो similar question फिर से आ गया. So you can mark the right answers. Hypoglossal nerve causes deviation of tongue to same side, opposite side. So this is easy one, I think. Hypoglossal nerve injury causes. Hypoglossal nerve injury causes. Question number 63, please mark the right answer, my dear aspirants. मुझे आंसर सही मिल गए. कोटेक कुमार एंड डॉक्टर लिट एब्सोल्युटली करेक्ट A, and I think everybody is knowing because we have just solved similar kind of MCQ before also. Yes, deviation of tongue to the same side. Yes. Now true statement about parathyroid gland. True statement about parathyroid gland. Yes, everyone is right. Yeah, everyone is right. Everyone is correct. Everyone has given the right answer. Okay, true statement about parathyroid gland. Question number 64, which is the true statement? Superior parathyroid developed from third pharyngeal pouch. Superior parathyroid is not constant in position. So according to you, which is the best answer here? Question number 64. Question number 64. Let's talk about 64. Superior parathyroid developed from endoderm of third pharyngeal pouch. So question number 64, which is the right one? You can write 64 and give the answer because I am getting confused whether the answer you are telling about the previous question or this one. So the correct statement about, the true statement about parathyroid gland, if I have to mention, it is the inferior parathyroid, otherwise called as the third parathyroid. Inferior parathyroid is constant in position, is not. The superior one is constant in position, and actually the superior parathyroid is constant in position, not the inferior, and superior parathyroid developed from fourth pharyngeal pouch, not the third. So inferior parathyroid, otherwise called as the C. Yes, Putin and Kotick, absolutely right. So you can see it is located in the posterior border or posterior aspect of thyroid gland is the parathyroid glands. एंड पैराथायरॉयड ग्लैंड में हम अगर सुपीरियर की बात करें तो इट अराइजेस फ्रॉम फोर्थ फैरेंजियल पाउच, अगर मैं इन्फीरियर की बात करूं तो इट अराइजेस फ्रॉम थर्ड फैरेंजियल पाउच. नाउ okay, now coming to question number, okay, now coming to question number, so please mark this question number. Yeah, you can tell me, buccinator muscle is pierced by, what is the right answer? Buccinator muscle is pierced by 65. Buccinator muscle is pierced by, my question is buccinator muscle is pierced by 65. Buccinator muscle is pierced by, question number 65. Buccinator muscle is pierced by. So Kotak Kumar, Gurjar Deva, absolutely the right answer is C. Actually the key which is provided to you उसमें A answer है. I want everybody to note down, जो key आपको दी गई है उसमें buccal branch of facial nerve है, लेकिन correct answer C है. So don't go towards the key. Actually the correct answer will be buccal branch of mandibular nerve. Buccinator muscle is pierced by, yes Ankit Pandey, you are absolutely right. Buccal branch of mandibular nerve is the right answer. Structure piercing buccinator, you can just note down structure piercing buccinator muscle. अगर मैं structure piercing buccinator की बात करूँ तो structure piercing buccinator is buccal branch of mandibular nerve, molar glands of the cheek and parotid duct. So the correct answer, absolutely right, C is the correct answer, which is given by many of you. Yes, absolutely right, C is the right answer. Okay, you didn't get the key. Okay, very good. So C है, key में A है. So please note down, key जो आपको मिलेगा उसमें A है, लेकिन please note down everyone कि 65 का आंसर C सही होगा. ओके, क्वेश्चन नंबर 65 का आंसर सी सही है. की में गलती से ए मार्क हो गया था, बट आंसर कौन सा सही होगा वो है सी. गॉट इट? गॉट इट एवरीवन? ये कंफ्यूजन चला जाएगा. आंसर कौन सा सही है? सी. 65 क्वेश्चन नंबर का आंसर सी सही है. ठीक है. नाउ ग्रेट सेरेब्रल वेन ऑफ गैलन इज फॉर्म्ड बाय द ज्वाइनिंग ऑफ विच टू वेन्स? ग्रेट सेरेब्रल वेन ऑफ गैलन इज फॉर्म्ड बाय ज्वाइनिंग ऑफ विच टू वेन्स? Great cerebral vein of Galen is formed by joining which two veins? Okay, doctor, everyone, yeah. So की में वो 65 का आंसर गलत है, वो करेक्ट आंसर सी होगा, ए नहीं होगा, सी है करेक्ट आंसर. ठीक है. क्वेश्चन नंबर 66. ग्रेट सेरेब्रल वेन ऑफ गैलन इज फॉर्म बाय ज्वाइनिंग. Most correct one, most correct. Putin is telling B, D, mixed bundle of answers are coming up, and I got a right answer from Mukesh. Yes, two internal cerebral veins. The correct answer is the two side internal cerebral vein joins and forms great cerebral vein of Galen. You can see here internal cerebral vein is two side joining here and leading to the formation of great cerebral vein of Galen. Great cerebral vein of Galen. Okay. So these two veins are joining here to drain into great cerebral vein of Galen. Now, a elderly person having prostate hypertrophy returns to the urologist with another case of epididymis. The infection of Darto's muscle, यानी scrotum और Darto's muscle का enlargement से कौन सा lymph node affect होता है? So where is the lymph node of scrotum is draining? Mark the correct answer, dear. Question number 67. Question number 67. So it's D. Okay. Absolutely correct. D is the right answer. Superficial inguinal lymph node. So if we talk about the drainage of lymphatics from the scrotum dartos area, it is into the superficial inguinal lymph node. D is the right answer. These are all direct MCQs. Easy one, I think. These are easy one. True statement about the boundary of auscultation. Triangle of auscultation. Which is the boundary? Which is the true statement about the boundary? Please. So I am just checking your messages also. Yes. So yes, Dr. Subdeep Singh, Ashish, Gujjar Deva, Ankit Pandey, which is the correct statement about the triangle of auscultation boundaries. Auscultation boundaries, laterally by latissimus dorsi, medially by scapula, laterally by trapezius, or inferiorly by latissimus dorsi. Question number 68, please mark the right answer. Question number 68. 68 is C, given by Kotak, given by Dr. Subdeep Singh. World Cricket, yes, C is the right answer. C is the right answer. Absolutely correct. See here, this is triangle of auscultation, and here in this triangular space, if this is the triangular space which is called as triangle of auscultation, so you can clearly see that this triangular space, inferiorly it is having latissimus dorsi, okay, above and medially it is having trapezius and that of medial border of scapula. So inferiorly latissimus dorsi is absolutely right answer. Absolutely right answer. Now, which of the following sensation is not perceived by? Which of the following sensation is not perceived by the spinal nucleus of trigeminal nerve? Which of the following sensation is not perceived by spinal nucleus of trigeminal nerve? Which of the following sensation is not perceived by spinal nucleus of trigeminal nerve? So I got an answer 69. Kotak and Sudeep, absolutely right. Proprioceptive sensation is absolute. Proprioceptive sensation is by which nucleus of trigeminal? Mesencephalic nucleus. It is by mesencephalic nucleus. So please note down, अगर proprioceptive sensation की बात करें तो it is from the mesencephalic nucleus of trigeminal nerve. Absolutely correct. Absolutely correct. So the correct answer is D. Mesencephalic nucleus is for the proprioceptive sensation. Now let's talk about question number 70. Damage to which of the following nerves leads to the sensory loss on the adjacent side of the great toe and the second toe, and also impairs the dorsiflexion of the foot? So that is a hint provided. Dorsiflexion of the foot is done by which nerve? That will give you the correct answer. Damage to which of the following nerve leads to sensory loss on the adjacent side of the great and second toe and impaired dorsiflexion of the foot? Ma'am, what is proprioceptive? Oh, okay. So yes, Dr. Litt has asked what is proprioceptive sensation. मैं बताती हूँ. हमारे पास जब sensation है वो stereoceptive होता है, proprioceptive होता है. Stereoceptive का मतलब the sensation which is from the external environment, like the sensation of pain, the sensation of cold, warm, so the temperature sensation. ये हमारा जो changes है exterior environment के कारण जो sensation feel होता है उसको बोलते हैं exteroceptive sensation. अगर मैं बोलूँ proprioceptive sensation, that is from one's body, like joint, muscle sense, vibration sense of own body sensation is called as the proprioceptive sensation. So that is the difference between exteroceptive and proprioceptive sensation. Is it okay, Dr. Litt? तो जो सेंसेशन हमें एक्सटर्नल इन्वायरमेंट से रिसीव होती है तो उसे बोलते हैं एक्सटीरियोसेप्टिव, जैसे कोल्ड, टेम्परेचर, पेन. और जो सेंसेशन हमारे ओन बॉडी, जैसे मसल जॉइंट सेंसेशन, प्रेशर सेंसेशन, लाइक मसल जॉइंट सेंसेशन, लाइक दैट ऑफ द वाइब्रेशन सेंस, दीज आर ऑल प्रोपायोसेप्टिव सेंसेशन. ओके, डॉक्टर लिट? Damage to which of the following? Yes, deep peroneal nerve is the right answer. Deep peroneal nerve is the right answer. Deep peroneal nerve is giving, so see here, अगर मैं deep peroneal nerve की बात करूँ तो it is giving sensory innervation, it is giving cutaneous sensory innovation in the first web space. Now, all of the following pair regarding neural columns and associated nuclei is right except. All of the following pairs regarding neural column and associated nuclei is right except. So क्वेश्चन नंबर 71. सो एक्चुअली यहाँ पे ई का मतलब क्या होता है, जैसे GSC का मतलब क्या होता है, जनरल सोमैटिक इफरेंट. SVE का मतलब स्पेशल विजुअल इफरेंट. इफरेंट का मतलब मोटर और एफरेंट का मतलब सेंसरी होता है. एफरेंट का मतलब सेंसरी होता है. ठीक है. तो यहाँ पे तो यहाँ पे डॉक्टर सुदीप सिंह हैज़ गिवन absolutely the right answer. यहाँ पे dorsal nucleus of vagus is not GVA but it will be GVE, that is general visceral efferent. ये general visceral efferent है and dorsal nucleus of vagus along with superior salivatory nucleus, inferior salivatory nucleus, lacrymatorial nucleus, Edinger Westphal nucleus, ये सारे जो nucleuses हैं they are related to parasympathetic innervation. So they are related with the parasympathetic supply and they are efferent, not the afferent. Hypoglossal nucleus is general somatic efferent is correct. Nucleus ambiguous which is giving innervation to larynx, pharynx and they are the composite nucleus for 9th, 10th and 11th. They are composite nucleus for 9th, 10th, 11th cranial nerves, and nucleus of tractus solitarius which is for taste sensation is also an afferent. So only the associated nucleus which is not correct is the C. Yes, Ashish, absolutely right, absolutely right. Now, which of the following, this is an easy one I think. Now, which of the following is in respect to anatomy is the true, all of the following except. So, which is the incorrect one? With respect to basic anatomy, this is a question of general anatomy, which is the incorrect statement. Question number 72. You have to choose the incorrect one. Compact bone is present in diaphysis of long bone. 72B. Kotak Kumar, no. You have to choose the incorrect. Your Tukka A. No. No put in. Havration. I will give you a hint. Can you tell me havration system is present in the bone? So, is it present in compact bone or it is present in? So, this is a question of general anatomy. D is the right answer. D is the right answer. Havration system is not absent but it is present. It is present, dear. It is present in compact bone. Diaphysis is primary ossification, absolutely correct. Compact bone is present in the middle or shaft is absolutely correct. Cancellous bone is present in epiphysis. Yes dear, the most incorrect is havration system. अगर मैं structurally और histologically बात करूँ bone का, compact bone के बारे में, तो उसका जो structural और functional unit होता है उसे हम बोलते हैं havration system. The other name of havration system is osteon. इसका दूसरा नाम क्या है? Osteon है. So absolutely it is present in compact bone. So see here, ends of the bones are epiphysis and shaft of the bone is the diaphysis, and this is made of compact bone. See here, spongy bone is present at the ends and compact bone is present in the diaphysis middle part. अगर आप कॉम्पैक्ट बोन की हिस्टोलॉजी देखें तो कॉम्पैक्ट बोन के हिस्टोलॉजी में आप सेंटर पे ये जो स्ट्रक्चर देख रहा है आपको, व्हाट इज दिस? दिस इज द osteon which is called as the havration system. This is the osteon which is called as the havration system. So this is one havration system. इसको हम HS havration system या osteon बोलते हैं, which is consist of this. In the midline there is a havration canal and this is having a laminas which is surrounding it, which is consist of osteocytes. So this one unit which is the structural and functional unit of compact bone, this structure is present in compact bone which is called as havration system. So that is the correct one. Now, because of inflammation of the inflammatory bowel disease, that is the Crohn's disease. that is the Crohn's disease and small bowel obstruction leading to bowel ischemia, and elderly women requires bypass of her ileum jejunum, and it is scheduled for gastrocolostomy. The surgeon will ligate all the arteries that send branches to the stomach. Which of the following artery may be spared? क्वेश्चन नंबर 73. तो यहाँ पे हिंट दिया है कि सारे जो आर्टरीज है वो ब्लड सप्लाई स्टमक को दे रहे हैं. कौन सा ऐसा आर्टरी है यहाँ पे जो ब्लड सप्लाई ऑफ स्टमक को नहीं दे रहा है? तो आपको उस तरह से ये करेक्ट आंसर मिल जाएगा. क्वेश्चन नंबर 73. विच ऑफ द फॉलोइंग आर्टरी इज नॉट गिविंग डायरेक्टली ब्लड सप्लाई टू द स्टमक? सो यहाँ पे यस, विच ऑफ द फॉलोइंग आर्टरी इज नॉट गिविंग ब्लड सप्लाई टू द स्टमक? दैट इज द हिंट विच इज गिवन टू यू. 73. C is absolutely right answer. Inferior pancreatico-duodenal artery is giving blood supply to duodenum. Splenic artery branches, that is short gastric artery. Short gastric artery give blood supply. Gastroduodenal artery also give blood supply by right. इसका एक artery का नाम है right gastroepiploic artery. और लेफ्ट गैस्ट्रोइपीप्लोइक आर्टरी तो स्टमक को ब्लड सप्लाई देता ही है. तो करेक्ट आंसर क्या होगा? सी. सो फॉर दिस इज द क्वेश्चन, इजी वन ओनली, वेयर यू हैव टू नो द ब्लड सप्लाई ऑफ द स्टमक. सो ब्लड सप्लाई ऑफ द स्टमक इज फ्रॉम राइट एंड द लेफ्ट गैस्ट्रिक आर्टरीज on the lesser curvature, and on the greater curvature it is having right gastroepiploic artery and left gastroepiploic artery. On to the fundus part we have got short gastric artery. So these are the basic arteries which is providing blood supply. If you will see the pancreatico-duodenal artery, superior or inferior pancreatico-duodenal artery which is giving blood supply to duodenum. Got it everyone? Yes. Question number 74. Root value of common peroneal nerve. Root value of common peroneal nerve. What is the root value of common peroneal nerve? Question number 74. Root value of common peroneal nerve. Root value of common peroneal nerve. Yes, Ankit Pandey has given the right answer. Is the dorsal branch of ventral rami of L4, L5, S1 and S2. So yes, and Dr. Sudeep Singh, absolutely correct. Absolutely correct. So you can see this is the sciatic nerve which is having dorsal and ventral roots, and you can see the root value of tibial nerve is L4, L5, S1 and S2, and common peroneal is the dorsal division of L4, L5, S1 and S2. So this is exactly you can say this is exactly the nerves which is having this root value, and here it was a direct MCQ of the root value. So if you talk about common peroneal nerve, it is from dorsal division of the ventral rami of L4, L5, S1 and S2. Tongue muscle and extraocular muscle develops from which of the following sources? So tongue muscle and extraocular muscle develop from which of the following sources? This is a direct MCQ, dear. Tongue muscle and extraocular muscles develops from which of the following source? Question number 75. Question number 75, please mark the right answer. So अगर मैं बात करूँ टंग मसल की, it is arising from occipital. Yes, Kotek Kumar, absolutely right, and pre-occipital is extraocular muscle. So C is definitely the right answer. Absolutely correct. Occipital से टंग मसल अराइज होता है और प्री ऑक्सीपिटल सोमाइट से हमारा एक्स्ट्राओकुलर मसल ऑरिजिनेट्स होता है. तो लेट्स टॉक अबाउट लास्ट. So let's talk about the last 25 MCQs. So we are now left with only 25 MCQs. That is the last 25 MCQs. So let's start with this series. Is it okay, everyone? Can we start with the last 25 MCQ series? Okay, so let's start with the last 25 series, 76 to 100 MCQs. Okay, let me read the first MCQ for you. Okay dear, yes, which of these statement about adductor canal is incorrect? Which is the incorrect statement about adductor canal? Which of the following is the incorrect statement about adductor canal? Which of the following is the incorrect statement about adductor canal? A. It is the communication between femoral triangle and popliteal fossa. It is bordered posteriorly by the adductor longus and the magnus. It contains the nerve to vastus medialis. Femoral artery exits through hiatus in the adductor longus. Okay, so which is the incorrect statement about adductor canal? Okay dear, incorrect. You have to just mark the incorrect statement about adductor canal. So yes, I got an answer from Putin D. What about Sudeep Singh A? It communicates femoral triangle and popliteal. That is absolutely correct dear. We have to mark the incorrect one. So Dr. Putin is absolutely right. Femoral artery exits through hiatus in adductor longus is absolutely wrong. It passes through hiatus in which muscle? Adductor magnus. It should be magnus, not longus. It should be magnus, not longus. इनकरेक्ट स्टेटमेंट करना है तो अडक्टर मैग्नस होना चाहिए, अडक्टर लॉन्गस नहीं होना चाहिए. यहाँ पे आप देख सकते हैं बाउंड्रीज, हियर यू कैन सी द बाउंड्रीज ऑल्सो. तो अगर मैं बात करूँ बाउंड्रीज की तो आप देख सकते हैं बाउंड्रीज में मीडियली सार्टोरियस है, पोस्टीरियरली अडक्टर लॉन्गस एंड मैग्नस है, एंट्रोलैटरली वास्टस मीडियालिस है. कंटेंट की बात करूँ तो नर्व टू वास्टस मीडियालिस, फिमोरल आर्टरी, फिमोरल वेन एंड सिफाइनस नर्व है. ओके, बाउंड्रीज ऑफ अडक्टर कनाल की बात करें तो मीडियली रूफ सार्टोरियस से बनता है, पोस्टीरियरली अडक्टर लॉन्गस और मैग्नस होता है, एंट्रोलैटरली वास्टस मीडियालिस होता है. अगर कंटेंट की बात करें तो नर्व टू वास्टस मीडियालिस, फिमोरल आर्टरी, फिमोरल वेन एंड सिफाइनस नर्व है. So these are the contents, and definitely if we talk about the femoral vessels traversing through which opening, so it is traversing through the opening of adductor magnus muscle, not the longest one. Coming to the question number 77, which statement regarding arterial anastomosis around the hip joint is incorrect? Which statement regarding the arterial anastomosis around the hip joint is incorrect? The circumflex femoral artery arises from profunda femoris. The artery to the head of femur is a branch of femoral artery. The artery to head of femur enters through ligamentum teres. The hip joint is supplied by retinacular arteries. Question number 77. Which is incorrect statement? यहाँ पे कौन सा incorrect statement है? Putin has got A, circumflex artery profunda. Okay, Ankit is telling C. So here actually the correct answer is B. The artery to head of femur is a branch of femoral artery is wrong. Actually artery to head of femur is not directly the branch of femoral artery. All other options are absolutely correct. So you can see here, अगर हम बात करें यहाँ पे तो circumflex artery arises from profunda femoris. Yes, absolutely correct. Artery to head of femur enters through ligamentum teres is absolutely correct. And the hip joint is supplied by retinacular branches of medial circumflex femoral artery and that of lateral circumflex femoral artery. यहाँ पे artery to head of femur is a branch of femoral artery. This is the wrong statement, so it is the right answer. Artery to ligament. Here artery to head of femur is not directly the branch of femoral artery. Artery to head of femur is the branches from the other one, that is obturator arteries, the branches from medial lateral circumflex femoral arteries, but it is not a direct branch of femoral artery. So it's not a direct branch of femoral artery. Actually the source of hip joint blood supply comes from medial and lateral circumflex femoral artery. So mainly hip joint की blood supply आती है medial circumflex femoral artery से और lateral circumflex femoral artery से और also the branches of obturator artery, that is ligament of head of femur के artery, that is obturator artery, but not directly from femoral artery. Now question number 78. A 40-year-old man comes to the office for evaluation of a neck lump. He first noticed the lump is 4 months ago while he was shaving and says that it seems to be growing in his size. Physical examination shows that it's a nodular mass in the left thyroid lobe. He has no pain, shortness of breath, cough, hoarseness or difficulty in swallowing. Serum TSH level is normal. Fine needle aspiration biopsy is consistent with the papillary thyroid cancer. A total thyroidectomy is performed, and while attempting to ligate the inferior thyroid artery, the surgeon accidentally injures a nerve lying in close proximity with it. So which of the following nerve is injured? $78. Ankit Pandey is telling C. Putin is telling C. Apurva is telling D. Ashish is telling C. Dr. Lit is telling D. The correct answer is C. Recurrent laryngeal nerve. इतनी सारी जो क्लिनिकल हिस्ट्री इसने दी है ये इस क्वेश्चन में, एक्चुअली तो कैरेक्टरिस्टिक पॉइंट क्या दिया है, लाइगेट इंफीरियर थायरॉइड आर्टरी. तो नर्व जो इसके साथ रन होता है वो रिकरेंट लैरेंजियल नर्व होता है. एक्चुअली रिकरेंट लैरेंजियल नर्व इज लोकेटेड इन क्लोज प्रॉक्सिमिटी विद इंफीरियर थायरॉइड आर्टरी and external laryngeal nerve is located in close proximity with that of superior thyroid artery. So that is an important point. I would like to show you a diagram for that. See here, यहाँ पे आप देख सकते हो, this is the external laryngeal nerve. An external laryngeal nerve is running close to which artery? Superior thyroid artery. External laryngeal nerve is running close to superior thyroid artery, and यहाँ पे inferior thyroid artery is running close to recurrent laryngeal nerve. तो अगर recurrent laryngeal nerve की इंजरी है, यानी कि जब सर्जन ने थायरोइडेक्टोमी ऑपरेशन परफॉर्म किया है, तो while ligating the inferior thyroid artery there can be a chance of injury to recurrent laryngeal nerve. अगर superior thyroid artery को ligate कर रहे हैं तो वहाँ पे चांस हो सकता है external laryngeal nerve की इंजरी की. ठीक है. Now coming to the question number 79. A 75-year-old man with a history of 40 packs of cigarette smoking की हिस्ट्री है. ठीक है. वहाँ पे उसको hypercholesterolemia diagnosed होता है. He has hypercholesterolemia is diagnosed with a severe atherosclerotic occlusion of which of the following artery result in insufficient perfusion of urinary bladder. यानी आपको बताना है यूरिनरी ब्लैडर की जो ब्लड सप्लाई है उसका इट्स कमिंग फ्रॉम विच सोर्स. क्वेश्चन नंबर 79. Blood supply of urinary bladder, that is from superior inferior vesical artery. So that is a branch of which of the following arteries? Mukesh is telling C, I think. 79. Question number 79. All of you can attempt 79. Kotik is telling C. Kotik Kumar. Putin is telling C. Ashish is telling C. Doctor. Okay, C is the right answer. Actually, the blood supply of urinary bladder is from superior vesical artery and inferior vesical artery. And these two are the branches of anterior division. These two arteries are branches of anterior division of internal iliac artery. Anterior division of internal iliac artery. So internal iliac artery is the right answer. So see here, यहाँ पे आप internal iliac artery देख सकते हैं. This is the internal iliac artery. This is the internal iliac artery which is giving uterine artery, gluteal arteries, vaginal arteries. It is giving superior vesical arteries, inferior vesical arteries and the obturator arteries. So definitely both the superior and inferior vesical arteries are the branches of internal iliac artery. Question number 80. Yes, epigastric में भी gastric है. Okay, question number 80. A soldier complains of foot pain following 85 kilometers mountain climb. Upon examination, the physician diagnoses tendonitis of the fibularis longus tendon because the tenderness is located deep onto the sole of the foot. It appears that the irritation occurs where the tendon lies against the bone covered by the structure. So, which is the structure covering it? Plantar aponeurosis, long plantar ligament, short plantar ligament, or tendon of tibialis posterior. Fibularis longus tendon involved deep to the sole. The irritation occurred, the tendon lies against which of the following ligament? Question number 80. Whether the answer is A, B, C, D. Kotek is telling A. Okay. Means you have to know the long, Assis is telling B. B is the right answer. Actually, long plantar ligament is the right answer. Actually, you have to see the close proximity of fibularis longus tendon and that of the ligament. So, long plantar ligament is lying close to it. Fibularis longus tendon is crossing the muscle, is crossing the foot lateral side, and the long plantar ligament is directly resting over it. अगर हम देखेंगे तो relation of fibularis longus muscle, that is peroneus longus muscle, or the long plantar ligament is very close to each other. So, you can see here, this is the fibularis longus muscle, and this is exactly lying very close to the long plantar ligaments. See here. So, exactly fibularis longus muscle is lying very close to long plantar ligament. So, definitely long plantar ligament is the right answer. इस डायग्राम में आप ये appreciate कर सकते हैं कि these two structures are lying very close to it. Lateral, if you will see, the two structures, peroneus longus or fibularis longus, is directly associated with the long plantar ligament. So, I will mark long plantar ligament as the right answer for question number 80. Let's move on to the next question number 81. Both short and long plantar ligament is giving inferiorly support to the foot. Now, let's talk about, this is showing you the origin insertion of tibialis posterior muscle also. Let's talk about question number 81. Perosteum is attached to the bone by which of the following fibers? Perosteum is attached to the bone by which of the following fibers? Perosteum is attached to the bone by which of the following fibers? That is peripheral lamellae, Sarpes fibers, elastic fibers, or Purkinje fibers. Mukesh is telling Sarpes fibers. What about others? Actually, yes, absolutely right. Sarpes fibers is absolutely right answer. Actually, Sarpes fibers is also called as bone fibers, or it is also called as bone fibers. It is also called as anchoring fibers, and these fibers are giving support to the interior of the bone from the perosteum it is attached. So, you can see from the perosteum these fibers are going interior of the compact bone and giving support to the bone. So, let's talk about the next question number 82. Fibrocartilage has got predominance of which type of collagen fibers? Fibrocartilage has got predominance type of which type of the collagen fibers? Fibrocartilage has the predominance of which type of collagen fibers? 82. Question number 82. Ankit Pandey is telling B, Mukesh is telling A. So, actually the correct answer is A. Fibrocartilage is having type 1 collagen fibers, hyaline and elastic. अगर मैं बात करूँ hyaline और elastic cartilage की तो both of it is having type 2 collagen fibers, but अगर हम fibrocartilage की बात करते हैं तो it is having type 1 collagen fibers, type 1. So, definitely A is the right answer. Now, question number 83. A young boy presented with hypoparathyroidism, absence of thymus gland, tetanic cleft palate, small mouth and jaw, low set ears, short statures, as you can see in the diagram, and it is associated with which chromosomal deformity? It is associated with which chromosomal deformity? It's a case of Dijor syndrome, and it is having, yes, absolutely, this is a case of Dijor syndrome. It is a first pharyngeal arch syndrome, and in this case what happens, this is a severe infection. The baby will have an association with severe infection. So Dijor syndrome is having an abnormality in the chromosome number 22, mainly the deletion of small segment of chromosome number 22, and the person or the baby which is very prone to infection. Congenital heart problems are there associated with several kinds of infection, delayed learning, cleft palate. These are the associated sign and symptoms which is associated with the condition of Dijor syndrome. And here this is associated with the first pharyngeal arch syndrome, which is having many of the abnormalities associated with it. The baby born is very prone to infection. Now, accessory obturator artery is a branch of accessory obturator artery is a branch of accessory obturator artery is a branch of So yes, it's very important for you to know that as obturator artery and accessory obturator arteries are branch of which artery? So actually obturator artery is the branch of internal iliac artery. If I talk about accessory obturator artery, this is the branch of inferior epigastric artery. Accessory obturator artery is the branch of inferior epigastric artery. Got it? So actually there is a clinical importance of accessory obturator artery when we are accessory मतलब abnormal obturator artery. अगर आप ये डायग्राम देखो तो यहाँ पे आपको ये जो स्ट्रक्चर दिख रहा है ये लैकुनार लिगामेंट है, ठीक है, ये लैकुनार लिगामेंट है, और ये जो आप हर्निएशन देख रहे हो, दिस हर्निएशन इज थ्रू द femoral ring. So in cases of strangulated femoral hernia, when operation has to be performed, जब स्ट्रैंगुलेटेड फिमोरल हर्निया में ऑपरेशन परफॉर्म होता है तो हम क्या करते हैं, कट करते हैं मीडियली. विच किसको कट करते हैं, लैकुनार लिगामेंट को कट करते हैं मीडियली. तो हम लैकुनार लिगामेंट को कट करते हैं मीडियली. तो इन दैट केस सो दैट वी कैन रिपेयर द केस ऑफ फिमोरल हर्निया एज क्विकली एज पॉसिबल. सो जनरली हम लैटरली कट नहीं करते हैं. और रीज़न क्या है लैटरली नहीं कट करने का, क्योंकि वहाँ पे हमारे पास फिमोरल वेसल्स है. वहाँ पे हमारे पास क्या है, फिमोरल वेसल्स है. यहाँ पे ये फिमोरल वेन है और ये फिमोरल आर्टरी है. लेकिन मीडियली कट कर सकते हैं क्योंकि वहाँ लैकुनार लिगामेंट. लेकिन समटाइम्स क्या होता है, एबनॉर्मल ऑब्ट्यूरेटर आर्टरी ये लैकुनार लिगामेंट पे रेस्ट करती है. और ये जो एबनॉर्मल ऑब्ट्यूरेटर आर्टरी है, इट्स अ ब्रांच ऑफ इंफीरियर एपिगैस्ट्रिक आर्टरी विच इज इन सम ऑफ द केसेस इट इज लाइंग ऑन ओवर द लैकुनार लिगामेंट. सो उस केस में क्या हो सकता है, हैवी ब्लीडिंग हो सकती है इफ द सर्जन इज नॉट नोइंग the anatomy related to the lacunar ligament. So inferior epigastric is the source of accessory obturator artery. Okay, now let's talk about question number 85. A 42-year-old male injured in a petrol station explosion was found to have multiple small metal fragments in his thoracic cavity. Since the pericardium was torn inferiorly, the surgeon began to explore for the fragments in the pericardial sac. Slipping her hand under the heart apex, she slides her fingers upward and to the right within the sac until they were stopped by the cul-de-sac by the pericardial reflections near the base of the heart. So her fingers were in which space? Mukesh, yes, obturator artery usually arises from internal iliac artery. Mukesh wants, so we are coming to this, so yes. नॉर्मल, अगर नॉर्मल की बात करें, नॉर्मल ऑब्ट्यूरेटर आर्टरी, yes Mukesh, you can note down, normal obturator artery is the branch of anterior division of internal iliac artery. Apurva Shri, ma'am, questions are too long. Questions are long, answers are easy. Don't worry. Shri, questions are long but answers are easy. यहाँ पे जो क्लिनिकल क्वेश्चन होते हैं ना, एक्चुअली आपके एफएमजी एग्जाम का जो श्री और मैं सबको बोलना चाहूँगी, आपके जो एफएमजी एंट्रेंस एग्जाम है ना, उसका लेवल इंक्रीज हो रहा है डे बाय डे, है ना. आपने देखा होगा 4-5 ईयर्स पहले इतने टफ क्वेश्चंस नहीं आते थे, लेकिन अगर आप 1-2 साल पहले के क्वेश्चंस देखेंगे तो उसमें क्लिनिकल क्वेश्चंस, इमेज बेस्ड क्वेश्चंस, कैडावरिक इमेजेस पूछे जाते हैं. तो वो लेवल इंक्रीज हो रहा है, इसीलिए डोंट वरी. यहाँ पे क्या है ना, इतना जो क्लिनिकल एनाटमी है उस पर नहीं ध्यान देना है, वो तो पढ़ना है, लेकिन सबसे इंपॉर्टेंट कीवर्ड्स होते हैं. जो भी आप क्वेश्चन सॉल्व करते हैं ना, तो उसके कीवर्ड्स पे आपको ध्यान देना. तो यहाँ पे जो कीवर्ड्स है ना, पेरिकार्डियल रिफ्लेक्शन नियर द बेस ऑफ द हार्ट, वो आपको हिंट दे रहा है करेक्ट आंसर. ठीक है. तो करेक्ट आंसर क्या है? पेरिकार्डियल रिफ्लेक्शंस नियर. द करेक्ट आंसर के लिए आपको क्या, कौन से वर्ड पे ध्यान देना है? वो है पेरिकार्डियल रिफ्लेक्शंस नियर द बेस. सो पेरिकार्डियल रिफ्लेक्शंस नियर द बेस आपको सो हमारे बेस ऑफ द हार्ट. सो आपको जानना है बेस ऑफ द हार्ट इज फॉर्म्ड बाय विच चेंबर ऑफ द हार्ट. इसको करेक्ट आंसर के लिए बेस ऑफ द हार्ट इज फॉर्म्ड बाय विच चेंबर ऑफ द हार्ट. बेस ऑफ द हार्ट इज फॉर्म्ड बाय लेफ्ट एटीरियल चेंबर, लेफ्ट एट्रियम और लेफ्ट एटीरियल चेंबर. और लेफ्ट एटीरियम और लेफ्ट एटीरियल चेंबर में 4 पल्मोनरी वेन्स ऑब्जर्व होता है और एक साइनस बनाता है जिसका नाम है ऑब्लिक साइनस. यानी कि करेक्ट आंसर क्या होगा? डी, ऑब्लिक साइनस. यहाँ पे जो सारा ये जो क्वेश्चन है, जो भी फ्रैगमेंट है, थोरैसिक कैविटी में इंजुरी है, उसके कारण जो सैक्स में जो सर्जन ने अपने फिंगर्स को डाला, वो पेरिकार्डियल रिफ्लेक्शन नियर द base of the heart. और base of the heart is formed by which structure? Base of the heart is formed by left atrial chamber of the heart. और left atrial chamber में 4 pulmonary veins open होती है, and due to the opening of 4 pulmonary veins in the left atrial chamber, there is formation of oblique sinus. So the correct answer will be oblique sinus. Okay dear. So oblique sinus is lying in the pericardial cavity in the left atrial chamber where the serous pericardium is reflected. So in this diagram आप देख सकते हो, ये जो oblique sinus है, it is formed in the left atrial chamber due to the opening of 4 pulmonary veins here. 4 pulmonary veins. So the surgeon is slipping her finger in the oblique sinus because वहाँ पे लिखा हुआ है कि वो जो है वो नियर द बेस ऑफ द हार्ट. और बेस ऑफ द हार्ट इज अपोजिट टू द एपेक्स ऑफ द हार्ट. एपेक्स ऑफ द हार्ट इज फॉर्म बाय लेफ्ट वेंट्रिकल, एंड अपोजिट टू लेफ्ट वेंट्रिकल कौन सा चेंबर ऑफ द हार्ट लाई करता है? लेफ्ट एट्रियम. एंड लेफ्ट एट्रियम में 4 पल्मोनरी वेन्स ओपन करते हैं, इसलिए ऑब्लिक साइनस इज द राइट आंसर. कोरोनरी साइनस तो हो ही नहीं सकता बिकॉज इट इज अ वेन. कोरोनरी सल्कस इज ऑल्सो ए एट्रियोवेंट्रिकुलर ग्रूव. कोस्टोमीडियास्टिनल रेसिस इज लाइंग लोअर डाउन. सो द करेक्ट आंसर विल बी ऑब्लिक साइनस. A thyroid mass usually moves with sallowing. A thyroid mass usually moves with sallowing. And it is enclosed with which fascia? It is enclosed with which fascia? Carotid sheath, investing layer of deep cervical fascia, pretracheal fascia or prevertebral fascia. So this question is directly asking you, the thyroid gland is forming its fibrous capsule or the false capsule by which layer of deep cervical fascia? So thyroid gland is forming its capsule by which layer of deep cervical fascia? This is the answer. This is how you can approach to the correct answer. The correct answer is pretracheal layer of deep cervical fascia. So actually, if you will see this diagram, longitudinal view, you can see this is the pretracheal fascia which is arising from the hyoid bone, enclosing the thyroid cartilage, cricoid cartilage, and here you can see it is enclosing the thyroid gland, and lower down it is merging with the fibrous pericardium of the heart. So clearly you can see the thyroid gland is enclosed by which layer of the deep cervical fascia? The answer is pretracheal layer of deep cervical fascia. अगर ये डायग्राम देखेंगे तो यहाँ पे भी आप देख सकते हैं thyroid gland is enclosed by pretracheal layer of the deep cervical fascia. Pretracheal layer of deep cervical fascia. Now going to the question number 87. In an accident involving factory machinery, the worker receives a cut on the dorsum of his ankle. And you inspect the wound, you find that no tendons are cut, but the dorsalis pedis artery and a combined nerves has been cut. So what would be suspected here? Whether it is a case of clubfoot, foot drop, inability to extend the big toe, numbness of the first and the second toe. Question number 87. So in this question you have to know dorsalis pedis artery is running close to which nerve. आपको जानना है कि dorsalis pedis artery is running close to which nerve, and then you can give me the right answer. Dorsalis pedis artery is running close to which nerve, and that will provide you with the best correct answer. So can you tell me which nerve is involved? So yes, D is the right answer, but what is the nerve which is running along with dorsalis pedis artery? Dorsalis pedis artery के साथ कौन सी nerve run करती है? Which nerve is running close association with dorsalis pedis artery? Yes, Vicky, 87C is the right answer. Just tell me which nerve is running close to dorsalis pedis artery. So which nerve? The nerve is deep peroneal nerve. Yes, I got an answer from Ankit Pandey. Deep peroneal nerve. Absolutely right. Absolutely right, Ankit Pandey. Absolutely right. So right answer is given by Ankit Pandey. So yes, dorsalis pedis artery is running along with deep peroneal nerve. So definitely deep peroneal nerve is involved, and if deep peroneal nerve is involved, it is giving, and just in one of the MCQ I have discussed the innervation of the first web space, the innervation of the cutaneous sensory innervation between the first web space is given by deep peroneal nerve. So definitely deep peroneal nerve is the right answer. Numbness in first and second toe is due to involvement of deep peroneal nerve. Question number 88. A 70-year-old man was diagnosed with acoustic neuroma, where it enters into temporal bone. What other cranial nerve might be affected, since the nerve used the same foramen as that of 8th cranial nerve? Question number 88. So यहाँ पे स्पेशल नर्व के साथ कौन सी नर्व ट्रैवर्स होती है? नहीं, यहाँ पे 8th नर्व के साथ कौन सी नर्व ट्रैवर्स होती है? Yes, facial nerve is the right answer. Actually ये बता रहा है आपको acoustic neuroma, and we know that when we are talking about facial nerve and vestibulocochlear nerve, internal acoustic meatus की बात हो रही है, और internal acoustic meatus में labyrinthine vessel जाता है along with the internal acoustic meatus में labyrinthine vessel जाता है along with that of 7th and 8th cranial nerve. So facial nerve enters along with vestibulocochlear nerve in the internal acoustic meatus. So that is the right answer. You can see here internal acoustic meatus में structures जो traverse करते हैं वो 2 cranial nerve है, वो है 7th और 8th. I have included this diagram because all important nerves like olfactory nerve from the cribriform plate, optic canal से second nerve, superior orbital fissure से trochlear, oculomotor, abducen nerves, foramen rotundum से maxillary, foramen ovale से mandibular nerve, jugular foramen से 9th, 10th, 11th nerve और hypoglossal canal से 12th cranial nerve पास कर रही है. Internal acoustic meatus से 7th and 8th cranial nerve पास कर रही है. Now, which of the following forms from paraaxial mesoderm? Which of the following structure forms from paraaxial mesoderm? Now, which of the following structure is formed from paraaxial mesoderm? Which of the following structure is formed from paraaxial mesoderm? ओके, क्वेश्चन नंबर 89. पैराएक्सियल मेसोडर्म यानी मसल जो है वो हिंट क्या है? मसल अराइज करेगा ना पैराएक्सियल मेसोडर्म से. सो कौन सा मसल है? बाइसेप्स. बाइसेप्स ब्रेकाई विल बी द राइट आंसर डियर. बाइसेप्स ब्रेकाई. So muscles of the extremity is formed from somites. और हम जानते हैं एक्सट्रीमिटी का मसल सोमाइट से बनता है, और सोमाइट किससे बनता है? पैरा एक्सियल मेसोडर्म से। सो स्पेशली पैरा एक्सियल मेसोडर्म से, सो बाइसेप्स ब्रेकाई पैरा एक्सियल मेसोडर्म से होगा। अगर हम बात करते हैं डिफरेंट स्ट्रक्चर्स की, दैट इज़ द, अगर हम बात करें कनेक्टिव टिश्यू एंड ऑल, दैट इज़ फ्रॉम सोमैटोप्लूरिक मेसोडर्म। अगर हम यूरोजेनाइटल स्ट्रक्चर्स की बात करें, एड्रिनल कॉर्टेक्स की बात करें, तो दैट इज़ फ्रॉम इंटरमीडिएट मेसोडर्म। एड्रिनल मेडुला इज़ फ्रॉम न्यूरल क्रेस्ट। सो ऑब्वियसली एड्रिनल मेडुला न्यूरल क्रेस्ट से फॉर्म करता है। बोन्स एंड कॉर्टेक्स एंड ऑल वी हैव सीन ऑलरेडी, दैट इज एड्रिनल इंटरमीडिएट मेसोडर्म से यूरोजेनाइटल सिस्टम एंड दैट ऑफ एड्रिनल कॉर्टेक्स। तो इंटरमीडिएट मेसोडर्म से फॉर्म करता है यूरोजेनाइटल सिस्टम, सोमैटोप्लूरिक मेसोडर्म से कनेक्टिव टिश्यू एंड बोन्स। तो यहाँ पे मसल्स है, तो बाइसेप्स ब्रेकाई इज फ्रॉम द पैरा एक्सियल मेसोडर्म, जो कि सोमाइट्स फॉर्म करता है। Now question number 90. A patient with a history of chronic gastroesophageal reflux disease is admitted to the emergency OPD. He has got severe heartburn and chest pain. Biopsy of esophagus reveals a change in epithelial lining of the lower one-third of esophagus from the squamous type epithelium changing to columnar type of epithelium. ये hint आपको provide किया है कि squamous epithelium किस में form कर रहा है? columnar epithelium है। तो patient is taking proton pump inhibitors. And what is the clinical condition associated with the esophagus? Such kind of change of epithelium is associated with which clinical scenario of esophagus? Apurva, Assis, all of you have given absolutely right answer. The right answer is Barrett esophagus. Yes, there is a change in epithelium, and the change of, if I talk about the change in epithelium, so definitely the change of epithelium is seen in the case of Barrett esophagus. So there is change of epithelium, and this is the case of Barrett esophagus. Now coming to question number 91. A 63-year-old man comes to the OPD with 4-month history of persistent left ear pain that slowly worsens. He is also having some difficulty in swallowing. The patient has a case of non-chronic condition but has smoked 1 pack of cigarettes per day for the last 50 years. On examination, external auditory canal is patent, tympanic membrane is clear with no middle ear effusion. There is enlarged lymph node in the anterior neck. Flexible fibro-optic laryngoscopy reveals ulcerative mass on the posterior pharyngeal wall of the hypopharynx. So you can tell me the nerve which is the reason of patient ear pain. Cortex, everyone is taking great auricular nerve. No dear. So here जो hint है ना वो ये है कि अल्सरेटिव मास कहाँ है? पोस्टीरियर फैरेंजियल वॉल ऑफ हाइपोफैरिंक्स. सो ये एक रेफर्ड पेन का कंडीशन है. दिस इज अ केस ऑफ रेफर्ड पेन, पोस्टीरियर फैरेंजियल वॉल ऑफ द फैरिंक्स. सो आपको फैरिंक्स का नर्व सप्लाई पता होना चाहिए. इसको सही से आंसर करने के लिए आपको फैरेंजियल वॉल का नर्व सप्लाई पता होना चाहिए, एंड दैट इज बाय वेगस नर्व. दैट इज बाय वेगस. एक्चुअली ग्लोसोफैरेंजियल नर्व भी इनोवेट करती है, बट पोस्टीरियर फैरेंजियल वॉल की बात हो रही है तो दैट इज इनोवेटेड बाय, अगर पोस्टीरियर फैरेंजियल वॉल की बात करें तो दैट इज इनोवेटेड बाय वेगस नर्व. So the patient is having otalgia pain due to squamous cell carcinoma, and we know that the patient is referred pain of otalgia, and similarly we know that two nerves are important for this pain. Irritation of vagus nerve is there, similarly glossopharyngeal nerve also, but glossopharyngeal nerve is innervating upper part of pharynx, और यहाँ पे जो cancerous node है वो है posterior pharyngeal wall में. So we have to mark the correct answer. So definitely posterior pharyngeal wall की बात कर रहे हैं तो we will go with the vagus nerve. Okay, glossopharyngeal nerve is upper part of pharynx, but posterior pharyngeal wall की tumor involved है. That was mentioned in the MCQ कि posterior pharyngeal wall की tumor involved है, तो correct answer क्या होगा? vagus nerve होगा. Phylum terminal is chiefly composed of. Phylum terminal is chiefly composed of. Phylum terminal is chiefly composed of. Phylum terminal is chiefly composed of which of the following structure? So yes, okay, Dr. Litt, yes, I know that यहाँ पे आपको confusion हो रहा होगा कि phylum terminal is modification of pia matter. ये मॉडिफिकेशन ऑफ पाया मैटर है, दैट इज ओके, बट इट इज मेड मेनली ऑफ फाइब्रस टिश्यू. तो करेक्ट आंसर होगा सी. एक्चुअली आप लोग कंफ्यूज हो सकते हैं, आई कैन टोटली अंडरस्टैंड. बहुत ने ए आंसर दिया है क्योंकि फाइलम टर्मिने, लिगामेंटम, डेंटिकुलेटम है, ये सारे जो स्ट्रक्चर्स हैं वो मॉडिफिकेशन ऑफ पाया मैटर है या एक्सटेंशन ऑफ पाया मैटर. लेकिन यहाँ पे एक्सटेंशन नहीं पूछा, यहाँ पे चीफली कंपोजिशन पूछा है. यानी कि फाइलम टर्मिनल चीफली किस चीज से बना हुआ है, व्हाट इट कंटेन्स इनसाइड, किस चीज से बना हुआ है, व्हाट इट कंटेन्स इनसाइड. तो वहाँ पे आंसर फाइब्रस टिश्यू होगा. ठीक है. सो इट इज द फाइलम टर्मिनल, एंड इफ आई टॉक अबाउट फाइलम टर्मिनल, इट इज अप्रोक्सीमेटली 20 centimeters long, and if I talk about its constituent, it is mainly made of the fibrous tissues and connective tissues. Okay, it is mainly made of fibrous tissues and that of connective tissues. Question number 93. Dr. S.K. Chaudhary, absolutely right, absolutely right. A 66-year-old man hospitalized 3 days ago for left lower lobe pneumonia is evaluated for persistent fever. He has been receiving the appropriate intravenous antibiotics as determined by antibiotic susceptibility test of his sputum culture. The patient has a history of diabetes mellitus and hypertension. His temperature is 38 degrees Celsius, 100.4 Fahrenheit, pulse rate is 87 per minute. Examination shows dullness to the percussion and decreased breath sounds over the left lung. Imaging reveals loculated left-sided pleural effusion. A tube is inserted to drain the fluid via incision of fifth intercostal space in the mid-axillary line. So this is the key point, fifth intercostal space in the mid-axillary line. So which of the following is most likely involved in this case? Whether this structure involved is external oblique, serratus anterior, infraspinatus muscle, latissimus dorsi. So question number 93, please mark the right answer. यहाँ पे जो hint provided है वो है कि आपका जो drain put on किया गया है वो incise किया है left fifth intercostal space mid axillary line में, and that is the hint. तो वहाँ पे incision किस muscle में देंगे, external oblique में देंगे, serratus anterior में देंगे, infraspinatus में देंगे या latissimus dorsi. तो करेक्ट आंसर है serratus anterior muscle. Absolutely, the patient is likely having empyema and draining chest tube has to be done. So we have to, the tube यहाँ पे जो innervate होगा वो जो tube pierce करेगा वो external, internal, intercostal muscles को pierce करेगा, but before that it will insert serratus anterior muscle. Then only it can reach to the correct location. So serratus anterior is absolutely right answer. Yes, absolutely right answer is serratus anterior muscle to reach that level. So if we have to put the chest tube, you can see here the incision before putting the chest tube in this diagram also you can appreciate this is mainly cutted the muscle is the serratus anterior muscle. So definitely serratus anterior muscle is the right answer. Now coming to the question number 94. Following a surgical procedure on the right side of the neck, a patient can no longer raise the arm above the horizontal position. The patient also cannot shrug his shoulder. The shrugging is also not possible. So which of the following nerve is most likely to be injured in this case? Whether the nerve injured is axillary nerve, whether the nerve injured is great auricular nerve, whether the nerve injured is greater occipital nerve or spinal accessory nerve. Question number 94. So above the shoulder, above the horizontal position in shoulder, तो कौन सा movement involve है, कौन सा movements involve है, abduction, कौन सा movement involve है, abduction. And abduction is done by which muscle? Serratus anterior along with trapezius muscle. Robin Sidhu is absolutely right. Robin Sidhu is absolutely right. Vicky is absolutely right. And the D is the right answer. Yes, D is the right answer. Actually, यहाँ पे spinal accessory nerve involved है. जब हम side of the neck में incision देते हैं, posterior neck involved होता है, तो वहाँ पे spinal accessory nerve involved होती है, which is giving innervation to trapezius and sternocleidomastoid muscle. And we know that trapezius along with serratus anterior muscle is involved for overhead abduction. So spinal accessory nerve is the right answer. See here, spinal accessory nerve. This is the spinal accessory nerve giving innervation to sternocleidomastoid and that of trapezius muscle, and trapezius muscle along with serratus anterior is involved in overhead abduction. So absolutely D is the right answer. Now which of the following muscle is the chief muscle of inspiration? Which of the following muscle is the chief muscle of inspiration? Which of the following muscle is the chief muscle of inspiration? Yes, Vicky. Trapezius along with serratus. Trapezius along with serratus. Yes, Vicky. Yes, Vicky. Trapezius along with serratus is involved in overhead abduction. So, which of the muscle is the chief muscle of inspiration? It's a very easy one question. Chief muscle of inspiration is the diaphragm muscle. Chief muscle of inspiration is the diaphragm. So, obviously, you should know the muscle involved. So, when I am talking about inspiratory muscles, inspiration muscle, the important muscles are diaphragm and external intercostal muscle. External intercostal muscle. अदर देन दैट दूसरे मसल्स भी इन्वॉल्व होते हैं, जैसे कि एसेसरी मसल्स में सेराटस एंटीरियर मसल इन्वॉल्व होता है, स्केलिनस ग्रुप ऑफ मसल इन्वॉल्व होता है, स्केलिनस ग्रुप ऑफ मसल, सेराटस पोस्टीरियर सुपीरियर, and if I talk about expiratory muscle, so that is the muscle that mainly the muscle which is sternocostalis, subcostalis. So diaphragm is the prime muscle of inspiration. So chief muscle of inspiration is definitely the right answer will be C. Now coming to the next, bronchi. Kotik Kumar, expiration is the, yes, Kotik Kumar. If I talk about expiratory muscle, so yes, we will, just a minute, yes. So if I talk about, so just a minute, I will explain you. Actually, जब हम बात कर रहे हैं expiration muscle की, तो expiration is a passive process. कोटेक कुमार अगर एक्सपिरेशन की बात करें तो इट इज़ एन पैसिव प्रोसेस. ये एक पैसिव प्रोसेस होता है. एक्टिव प्रोसेस इंस्पिरेशन होता है, तो इसमें कोई मसल्स इन्वॉल्व नहीं होती है नॉर्मल. इट्स ए पैसिव प्रोसेस, इलास्टिक रिकॉइल of the lungs and no muscles are involved. Yes doctor, no muscles are involved. लेकिन अगर forced expiration होगा तो कुछ muscles involve हो सकते हैं. That is internal intercostal muscle, that is internal intercostal muscle, innermost intercostal muscle, serratus posterior inferior muscle. So ये सारे serratus पोस्टीरियर इंफीरियर मसल ये सारे इन्वॉल्व हो सकते हैं. ट्रांसवर्स थोरैसिक मसल इन्वॉल्व हो सकते हैं. ट्रांसवर्स थोरैसिक मसल, दैट इज इनर मोस्ट इंटरकॉस्टल मसल, इनर मोस्ट दैट इज इनर मोस्ट इंटरकॉस्टल मसल, फिर इनर इंटरकॉस्टल मसल, फिर आपको लाइक सबकॉस्टैलिस मसल इन्वॉल्व हो सकता है, स्टर्नोकॉस्टैलिस मसल इन्वॉल्व हो सकता है. ये सारे मसल, क्वाड्रेटस लंबोरम मसल, ये सारे मसल जो हैं इन्वॉल्व हो सकते हैं. ओके कोटेक, दीज आर द मसल विच कैन बी इन्वॉल्व इन फोर्स्ड एक्सपिरेशन. नॉर्मल कंडीशन में कोई मसल इन्वॉल्व नहीं होता, लेकिन फोर्स्ड एक्सपिरेशन में ये सारे मसल इन्वॉल्व हो सकते हैं. नाउ कमिंग टू द नेक्स्ट क्वेश्चन, bronchi are lined by pseudostratified epithelium. As the airway continues distally, the epithelium changes. Which of the following structure is last to disappear as the epithelium changes along with the respiratory tube? Which one is the main? Yes, the main is the transverse thoracic muscle, innermost and internal intercostal muscle. Kotik Kumar, it is the innermost and internal intercostal muscle. Innermost internal intercostal muscle, transverse thoracic muscle. Okay, innermost intercostal muscle and internal intercostal muscle. Okay, Kotik Kumar. Now, bronchi is lined with pseudostratified epithelium. As you move more distally, the epithelium changes. So, which of the following feature is last to disappear in respiratory tube? Okay, Kotik Kumar. Now, please mark the right answer for question number 96. Which of the following structure is last to disappear, to change distally? Cilia, Dr. Putin is telling cilia and the others are telling others. So, yes. So, if we talk about this answer, so definitely cilia is the right answer. Yes. So, actually cilia का क्या रोल है? Pseudostratified ciliated columnar cilia का रोल है dust particles, foreign structures को respiratory tube से बाहर निकालना, बाहर की तरफ हटाना. तो अगर हम बात करें जो changes होती है, अगर हम देखें respiratory और conducting system of the रेस्पिरेटरी ट्रैक में, तो अगर हम बात करें तो कंडक्टिंग से रेस्पिरेटरी में बहुत सारे चेंजेस होते हैं, कार्टिलेज का चेंजेस होता है, ग्लैंड्स का चेंजेस होता है, गोबुलर सेल्स का चेंजेस होता है, उसमें लास्ट जो चेंजेस होता है वो सीलिया का होता है. सो डेफिनेटली ए इज द राइट आंसर. नाउ ये एक ए मेल इन्फेंट प्रेजेंट्स विद ए प्रून बेली सिंड्रोम. दिस इज अ केस ऑफ प्रून बेली सिंड्रोम as shown in the photograph. So the abdominal musculature is not properly developed. So can you tell me the muscle affected developed from which of the following embryological structure? So via intermediate mesodome, splanchnic mesodome, hypomere or epimere? Question number 97. सो एक्चुअली आपको ये तो पता है कि मस्कुलेचर जो होते हैं वो डेवलप होते हैं पैराएक्सियल मेसोडर्म से. यस, सो पैराएक्सियल मेसोडर्म से डेवलप होते हैं. दे डेवलप फ्रॉम पैराएक्सियल मेसोडर्म सोमाइट्स एंड दे विल डिफरेंशिएट इनटू हाइपोमियर एंड इपीमियर. अगर इपीमियर की बात करूँ तो दैट इज गिविंग राइज टू द केस ऑफ मसल्स ऑफ बैक. हाइपोमियर इज द राइट आंसर. सी हियर इन दिस केस प्रून बेली सिंड्रोम, abdominal anterior abdominal muscles are affected and abdominal muscles are affected. prune belly syndrome में anterior abdominal wall muscles are affected. और अगर हम बात करें तो paraxial mesoderm क्या फॉर्म करता है? सोमाइट्स. और सोमाइट्स फिर से क्या फॉर्म करता है? इफ आई ओके अगर हम बात करें तो पैराएक्सियल मेसोडर्म सोमाइट्स फॉर्म करता है और सोमाइट फिर से क्या डिफरेंशिएट करके फॉर्म करता है? इट फॉर्म्स डर्माटोम. सो सोमाइट्स इज फॉर्मिंग डर्माटोम. इफ आई टॉक अबाउट सोमाइट्स आर फॉर्मिंग मायोटोम, डर्माटोम एंड स्क्लेरोटोम. यहाँ पे जो मायोटोम है, अगर हम बात करें मायोटोम की, तो इट इज फॉर्मिंग इपीमियर एंड हाइपोमियर. हाइपोमियर इज फॉर्मिंग द मसल्स ऑफ एब्डोमिनल वॉल एंड लिम्स एंड इपीमियर इज फॉर्मिंग द मसल्स ऑफ Epimere is forming the muscles of back. So what you can say, यहाँ पे जो केस है, यहाँ पे hypomere is the right answer because paraxial mesoderm differentiate into somites. Somites differentiate into dermatome, myotome and that of sclerotome. Sclerotome vertebral columns को बनाता है. myotome is forming the muscles और उसमें भी muscles के development को 2 भागों में divide करते हैं. तो epimere is forming muscles of back. It is forming muscles of back. Hypomere is forming muscles of anterior abdominal wall. So prune belly syndrome में anterior abdominal wall is affected. So the correct answer will be C. Now coming to the next 98. Hard palate is hard palate. P. Hard palate contains. So what is the hard palate? So यहाँ पे hard palate की क्या होती है? epithelium. What is the correct histology of hard palate? So mark the right answer. So no, it's a surgical treatment has to be done. Yes, application steroids, okay, Kotek and surgical treatment has to be done. Okay. Now, yes, if you talk about 98, so correct answer is, yes, it is having keratinized epithelium, mucosa, submucosa and B. B is the right answer here. So अगर हम बात करें हार्ड पैलेट की, अगर हम बात करें इसके हार्ड पैलेट की, तो डेफिनेटली अगर हम हार्ड पैलेट की बात करें तो वहाँ पे केराटिनाइज इपिथेलियम होता है. So okay, Kotek, what you were asking was prune belly syndrome की treatment. तो that is abdominoplasty. Okay, जो related structure है उसकी surgical treatment की जाती है. And if I talk about hard palate, so definitely B is the right answer. ये जो diagram आपको दिख रहा है, this is the hard palate histological part. यहाँ पे epithelium जो है वो keratinized है और यहाँ पे बोन का पार्ट यहाँ पे दिख रहा है, एंड इट इज हैविंग माइनर सैलिवरी ग्लैंड ऑल्सो. सो इट इज हैविंग केराटिनाइज इपिथेलियम, सबम्यूकोजल लेयर एंड माइनर सैलिवरी ग्लैंड्स. ना आइडेंटिफाई द हिस्टोलॉजिकल इमेज डियर. ये जो हिस्टोलॉजिकल इमेज है वो किस इमेज को दिखा रहा है? व्हाट इज दिस इमेज? विच हिस्टोलॉजिकल इमेज इज दिस? आइडेंटिफाई द हिस्टोलॉजिकल इमेज. विच टाइप ऑफ पैपिला इज इट? विच टाइप ऑफ पैपिला इज इट? No, not lip. Rohit Pandey, Dr. Sudheep Singh, absolutely. So circumvallate papilla is absolutely right answer. Yes, Apurva Shri is asking where is non-keratinized epithelium. Non-keratinized epithelium near the skin but not the skin. जो भी structure near the orifice के पास होगा तो वो non-keratinized होता है. For example, esophagus. For example, esophagus में non-keratinized epithelium होता है. कोई भी structures जो होते हैं, for example, tongue में नॉन केराटिनाइज एपिथेलियम होता है. जो भी स्ट्रक्चर किसी भी स्किन ऑरिफाइस के पास में होता है श्री, तो वो नॉन केराटिनाइज एपिथेलियम होता है. Mukesh, ma'am, after complete question, please tell me in question number 84 how it is inferior, it is external iliac. Okay, I will come to that point. So this is a circumvallate papillae. Okay, this is a circumvallate papillae. So यहाँ पे आप ऐसे केराटिनाइज और नॉन केराटिनाइज को याद कर सकते हैं. जो केराटिनाइज होता है वो स्किन हो गया और स्किन के आउटर एस्पेक्ट म्यूकोक्यूटेनियस जंक्शन में है. नॉन केराटिनाइज हमेशा आपके म्यूकोक्यूटेनियस जंक्शन के पास के स्ट्रक्चर्स होंगे. नाउ दिस इज अ सर्कमवैलेट पैपिला. Yes, this is the largest papilla of the tongue and this is dome shaped and this is also having non-keratinized epithelium. इसका भी non-keratinized epithelium होता है. इसमें भी non-keratinized epithelium होता है. Stratified squamous non-keratinized epithelium. Now coming to question number 100. Identify the histological slide. Identify the histological slide, whether it is fibro, hyaline, elastic or articular cartilage. Mukesh, question number 84 फिर से. Okay, I will tell. Let us finish this. This is the elastic cartilage. This is C is the elastic cartilage. See here. ये elastic cartilage क्यों है? The reason क्यों है? क्योंकि ये पूरे slide pink appear हो रहा है. It is consist of elastic fibers. It is consist of elastic fibers. ओके, ये इलास्टिक फाइबर्स है. इसके बीच में जो ये आप देख रहे हो ना, ये सारे लाइंस जो हैं, ये बीच में जो रन कर रहे हैं, ये सब इलास्टिक फाइबर्स. और ये जो एरिया है ये पेरोस्टियम है. नो, मैं बताती हूँ कैसे आप समझ सकते हैं. इलास्टिक फाइबर्स आर सीन. यस रोहित पांडे, डॉक्टर लिट. इलास्टिक फाइबर्स होंगे तो वो इलास्टिक कार्टिलेज होगा, पेरोस्टियम प्रेजेंट होगा. और यहाँ पे ये जो स्ट्रक्चर आपको दिख रहा है, ये सारे स्ट्रक्चर क्या है? कॉन्ड्रोसाइट्स है. और कॉन्ड्रोसाइट्स बहुत डेंस होता है. इलास्टिक कार्टिलेज में कॉन्ड्रोसाइट बहुत डेंस होता है एज कंपेयर टू हाइलिन एंड फाइब्रो. अगर आप फाइब्रो देखेंगे तो उसमें फाइब्रस फाइबर्स होते हैं. अगर आप फाइब्रस कार्टिलेज देखेंगे तो फाइबर्स होंगे ज़्यादा, कोलाजन फाइबर्स ज़्यादा होंगे. ओके डॉक्टर लिट. और अगर आप हाइलिन कार्टिलेज देखेंगे तो उसमें जो वो कॉन्ड्रोसाइट है वो ग्रुप में होता है, उसको हम बोलते हैं सेल नेस्ट. और इलास्टिक कार्टिलेज में इलास्टिक फाइबर्स होगा और बहुत ही ब्राइटली पिंक कलर का होगा, ब्रॉडर और ब्राइटली पिंक कलर का होगा. सो दैट इज हाउ यू कैन आइडेंटिफाई. सो ओके, 84 क्वेश्चन एक बच्चे ने बोला 84 क्वेश्चन को फिर से बताने के लिए. ओके 84 से यस आई थिंक मुकेश 84. Yeah, accessory obturator artery is a branch of. Yes, Mukesh, it is for you. Yes, actually inferior epigastric will be the right answer. External iliac artery आप इसीलिए नहीं बोलो क्योंकि directly external iliac artery का branch है inferior epigastric artery. Okay, मुकेश, यहाँ पे अगर direct branch की बात करें, you just understand like this. Inferior epigastric artery is the branch of external iliac artery. ठीक है, तो इनडायरेक्टली आप कह सकते हो कि inferior epigastric accessory obturator artery is a branch of external iliac artery. बट अगर डायरेक्ट ब्रांच कहेंगे तो inferior epigastric, देयर आर 2 epigastric arteries, एक का नाम है superior epigastric और एक का नाम है inferior epigastric. यहाँ पे superior epigastric artery is a branch of internal thoracic artery, लेकिन inferior epigastric artery is a branch of external iliac artery. तो accessory obturator artery अगर बात करते हैं डायरेक्ट ब्रांच तो करेक्ट आंसर ज़्यादा होगा inferior epigastric, ना कि external iliac artery. Yes, Dr. Lit, hyaline is bluish in color. Yes, Dr. Lit, hyaline is bluish in color. So yes, 84, question number 84, is it okay? I think one of the student has asked me, Mukesh, समझ में आया? Inferior epigastric artery is a branch of external iliac artery, तो you can say indirectly accessory obturator artery is a branch of external iliac artery. लेकिन अगर direct source बोलेंगे तो correct answer क्या होगा? Inferior epigastric artery. Is it okay, Mukesh? Everyone, so best of luck for your exam. Keep studying. All my blessings to you, and I hope this MCQs are very useful for you. A quick revision of the anatomy, so more of clinical and image based sessions I have taken. So all the best and keep studying. Is it okay, Mukesh and everyone? Can I end the session now? All the best. Mukesh, have you understood this? Yes, good night dear, good night to everyone. All my blessings to you for cracking the exam. Yes dear, so let's just end the session and let's yes, all the best dear, all the best. Thank you so much. Thanks everyone.